lovely. You know, it's just fun. It's great. Yeah, so great. So great. Never better. We're not supposed to about money. Go make some more coolers.
Yeah, so let me know what
Power.
Yeah, it looks like not.
Break in the exercise.
Yeah, 10 minutes.
So the formal work
Holiday
legislature
An obligation for the paper. Okay, well, we can definitely write that down. He has to be, expeditious, and we can do it. Yeah, obviously, like, you and all of your involved in the program yesterday, you can take the conference, so as soon as you get done with the end.
I mean, I'd rather stay as just I don't want to like do both poorly.
How long is the drive?
Well, it's 4 hours if you're adults, but you have to be able to get traffic. It's still be 45, so we need to make sure
You can never count on just what the GPS tells you if you're emailing your DC. Especially on driving.
like getting out of here for me.
I'm
Ours is the next one.
Absolutely. I don't know if you're planning on coming to the U.S. Conference of Mayors in January, but we usually, again, I don't want to get ahead of myself, but we usually host some sort of reception around that as well. So we'll be
Good. Yes, thank you very much.
Yes. Good stuff.
Thanks, Ben.
All right. Enjoy the program. At this time tomorrow, I'll be 4 hours into my ultra
I think
If I can encourage everybody to move forward and sit closer to the stage, it would be lovely to fill in at the front if possible. Thank you, guys. Is it on?
You want to start pushing, moving, waving people up?
Yeah. Good morning, everyone. Thanks for coming this morning. I just want to encourage you all to take seats closer to the stage, fill in at the front. Don't be shy. We'd love to have you guys closer to be able to engage with the speakers better. Thank you.
Okay, so I heard Okay, then what do I do? Perfect. Okay. Thank you. Keep moving.
Okay. Morning, everybody. Morning, everybody. We're going to go ahead and get started. I hope you had an excellent evening, as long as your partner didn't sink the 8-ball, for those of you who are in the know. Really had a great time yesterday. Just being back together again is still just on a high from getting to be all together in person. So great to see you. And so we're going to continue with our deep dive into different policy issues. Today we have a lot of conversations. We're going to start with healthcare, I'll talk about in a second, move on to criminal justice. We've got some great breakout sessions again today, and we'll end with a conversation about uniting America and the common ground we might find together. So looking forward to a great half day. But it's my great pleasure to start today. We're going to take a look at healthcare. Obviously, when we're thinking about building back better, not just public health, pandemic, but just, reimagining a public health, healthcare system in this country that works. And we're absolutely thrilled to have with us Natalie Davis. She is the CEO of United States of Care that she helped co-found with Andy Slavitt, who many of you might know. They've spent the last 2 years traveling the country, talking to Americans about their impressions of our healthcare system, their frustrations and challenges, and have put together some recommendations, 12 recommendations on moving forward with our healthcare system. So Natalie, thank you so much for being with us.
Good morning, everybody. It's so nice to be here. As Debbie said, I'm Natalie Davis. I'm the co-founder and CEO of an organization called United States of Care. We launched a couple of years ago, really with a focus on how do we build a healthcare system to ensure that everybody has access to quality, affordable healthcare, regardless of health status, social need, or income. And we really think about our goal is expanding this access to care in the near term, working with states and other change makers while paving a path towards durable, people-centered federal policies that achieve our mission. And I'll tell you more about that. We launched with a very specific purpose to be a nonpartisan organization where people across the spectrum, both private sector, public sector, and the political arena could come together to think about what solutions will get us to really have this healthcare system that doesn't change at the whim of an election. You can see our diverse board of directors. We also rely heavily on our leadership councils. These are founders that are excellent in advocates in healthcare, entrepreneurs who are using innovation to make sure we are building a better healthcare system. Our voices of real life, these are people across the country who are ordinary and extraordinary people who really help us shape the healthcare reform ideas we have on the needs of real people. All of our partners we engage with daily and are a big part of how we believe healthcare will change. So we really do our work in a unique way. We go across the country and talk to people about their experiences in healthcare. We center our vision and the work that we do really on what we hear from a diverse population. We talk to people across the political spectrum in different locations across the country, different incomes, different health status and disability, really to understand where are there shared values and needs across different people, and where can we focus where really unique needs and diverse needs happen. We then take that listening work and really design new policies. We have an innovation lab where we're sitting down with people across healthcare to design new healthcare solutions to tackle the hardest problems. But we're not just a think tank, we're a do tank, and we go out and run state and federal campaigns to make sure that these changes happen now and in the future. So like I've said a couple of times, why do we listen and what have we learned? So we're a 4-year-old organization, but over the last 2 years, we've gone across the country and talked to thousands and thousands of people across their healthcare experiences. At the bottom, you can see we take a really robust approach to our research methodology and really are listening for that authentic need. And then we go through qualitative and quantitative experiences to really make sure we're listening and hearing what people are saying and validating it through them. We believe that for our healthcare system to work, we have too many people that are worried about perhaps the bottom line or other industry needs, and really we can be the organization that are lifting up the needs of people and then working with those in healthcare to make the change. So what have we heard when we've talked to people about healthcare? And this is, so every time I do this, there's a moment where everybody in the audience nods and thinks about themselves as a patient or a caregiver to somebody and a loved one, and the kind of feelings that come across. These are resound across thousands of people because healthcare really is about people. So the cost of care is the #1 thing we hear when we talk to people. When you talk to them about any experience they have, insurance, working with a provider, or the concern that when they engage in healthcare, the struggle to pay for healthcare is the #1 concern people have. There is high anxiety when you talk to people about healthcare, and there's a feeling that this healthcare system is actually intentionally created to be complex and confusing. And because of that, there's a big distrust in our system. And because of that, people are really feel like they have to create a healthcare system, a little microcosm of the healthcare system that works for them. They take a lot of time to figure out their coverage and what does insurance look like, and really think about what they call almost hacking the system. I've got this provider, and I know I can text this pediatrician, but they only will do, work at this hospital, and so they've created this little system that that they've kind of hacked together. And because of that, there's actually a big fear of really radical change of our healthcare system. People agree that it doesn't work, but there's a real concern that this system that they've created for themselves would go away if we did radical changes. Real concern that their healthcare coverage is not there for when they need it. It's not dependable, and that's if you are in private, employer-based coverage, or if it's through our social safety net. There's a very small percentage of people engaged in the healthcare policy debate. No surprise, it's very confusing and hard to engage with. And then when you talk to people about how they think the healthcare system is working for themselves or for others, even with the poor experiences people have with the healthcare system, people really think other people have it worse. So when we talk to people about health equity or racism in healthcare, people sometimes talk about the experiences they have for their own, but even with the most horrible conversations we've had with people, the experiences they've told us about, they always feel like someone has it worse than them. And again, there's a real worry that major systemic changes in healthcare would kind of disrupt this hacking of a system, and instead people are really interested in targeted and impactful changes. Those are words that we use very specifically: targeted and impactful. A little bit more about the organization. In just 4 years, we have talked to over 4,000 people in 50 states, as I said. We really have used that information to help us make sure that we're doing our part in the vaccine, or in the COVID response, and right now in the vaccine confidence building. We also have, like I said, are really interested in uniting the private sector and the public sector around these needs. And so, as I'll talk to you guys about today, it's a sneak peek of our nation's first people-centered healthcare reform agenda. These are really ideas to bring partisan divides together because it's really based on the needs of people. We engage with policymakers across the country, sending out regular information, and in 2020 ran a candidate education program. We'll be doing the same in the years to come. We have then, one of our big moments this year was passing legislation to bring close to 1 million people more affordable insurance in 2 states. And I've also done a lot of work with Congress here, and especially on bringing broadband funding to make sure people have access to virtual care in areas that don't have it. So we know that systemically, as a country, we need to do better in healthcare. There are people that lost coverage during a national healthcare pandemic. That means our healthcare system doesn't work. Our way we insure people doesn't work. 1 in 5 non-white adults carry long-term medical debt. Suicide rates are up. Out-of-pocket costs are especially high, especially with prescription drugs. And then when you talk to individuals themselves, nobody thinks healthcare is really working for them. And especially if you're a person who faces a system that wasn't built for you and you don't see yourself in, there's a real feeling of your SOL if you need to engage the healthcare system. So, after 2 years of talking to people, we have defined 4 shared goals. So these are, again, across political parties, race, ethnicity, healthcare status, disability, location, income. These resonate every time we talk to people about it because it really was based first on talking and listening to people. We chose these words of these 4 goals very specifically because they really were to capture the sentiment and feeling that we hear people express. So the first goal is really to make sure people have this certainty they can afford their health care. This one could have said they can afford their health care, but again, when you talk to people, the anxiety about not being certain you can is one of the biggest issues. And so for us, we need a healthcare system where people are certain they can afford it. Number 2 is people have security and freedom that dependable coverage, insurance, provides as life changes. When you talk to people about their insurance, it is a feeling that it is not there when you need it. If you are sick, if you lose your job, if you become pregnant, if you get in a car accident, you have no idea and you do not trust your coverage is there for you. So we have a lot of work to do to make sure our insurance system is there. People can get personalized care they need when and how they need it. This is an idea that I want to have healthcare that really meets my needs, where you see me as a full body, a full person. You don't just take my mental health different from my chronic condition and body pains. And number 4, people experience a healthcare system that they can navigate and understand. Again, I said a lot of people feel like this healthcare system was created to intentionally be confusing, to make sure I don't use it. And we have a lot of work to make sure it's easy to understand and easy to navigate. And above all, in order to achieve this future, everyone can have access to quality, affordable healthcare, regardless, again, of their status, ability, social need, race, ethnicity, sexual orientation, income, and where they live. These are all statements that we have brought to public opinion, to polling, and they poll very high, again, across political parties. And so this is really important for us to make sure that we're hitting really these shared and needs across populations. So, hopefully you can see some of these small words. We started then over just this last summer with 70 different healthcare solutions that we wanted to bring to the public to say, okay, we know you have these goals for the healthcare system. What are solutions that will get us closer to this ideal healthcare system? We're at 70 different policy solutions, really making sure that those were fiscally possible. They were durable across political changes, that they were able to tackle, if implemented correctly, tackle some of the biggest inequities and disparities that our healthcare system and nation faces. And these are the 12 that over and over again, between focus groups and other qualitative methods and then quantitative through a poll, stood up again across all these demographics. The couple of the ones that stood out to me that I'd love to point out, again, cost is the number 1 issue, and all 12 of these solutions really take cost on. The biggest one across political parties and other demographics was addressing prescription costs. People feel like their prescriptions are too high, they can't afford them, they change all the time, and it really is a hindrance of not just getting your drug, but also going to the doctor. You'll see there on solution 11, we also tested, okay, if we bring down the cost of drugs, what about if we just make it more transparent? How are these prices set? Again, very highly rated. People, even if we don't tackle the costs, they want to know that the costs are more transparent in how we set them. Another one that really stood out to us was Solution 6 there, providing support to caregivers who are very sick to care for those loved ones in the home. This is the one usually if you are a caregiver, even if you don't use that word, you feel the real emotional need to and burden of having a loved one in your home, but you want that care for them instead of in an institution as long as possible. And so this is one that we thought maybe across gender or age might change and it would fall off with others. But again, this is one of the highest solutions, and even when we put one against the other, people still really rank this one really highly. Another one that a couple of these speak to is really this idea of having healthcare closer in your community, in your home, delivered by people that you trust, that look like you, that have been in your community and community built. And so a lot of these solutions really are helping people get healthcare virtually, getting care in their community. There's a real big conversation in some of the focus groups about mental health, especially, and getting that in your community, getting the mental health your kids need in their school and places where they already are. And finally, a real high, if you don't use the words, because it enters into the political sphere, but if you talk to people about expanding Medicaid, expanding Medicare or CHIP or other social programs, there is a real understanding that people need insurance, and we need to do everything we can to make sure we're expanding eligibility for Medicaid and other coverage options. So taking all these together, they really are solutions that we think bring people the peace of mind that they can afford their health care, that they can care for their loved ones in the house or in their community. They can get care in their community by people they trust and need, and really can get the kind of healthcare needs met where they can take care of themselves. I think that's all I wanted to say on this slide. So how will we achieve these solutions? As I said, we advocate for policy change at the state and federal level. What we really love about all of these solutions is that there are levers in the states, in the federal government, with Congress, with employers, with really lots of different parts of the entities that make up our healthcare system. So we will continue to advocate for policy change at the state and federal level. As I said, there are a lot of solutions there or things that people want where we don't have good policies or the policies don't take into account equities and disparities. So through our innovation lab, we are building new policies with what I call a open tent and a big table where we bring together policymakers, the public sector, entrepreneurs, real people to sit down and say, if we're tackling this problem, what are the barriers and how can we build new policy together? And then in order to make space for these changes, we know we need to have a different conversation as a country about where people align on what they need from this healthcare system. It has been very political. It is seen as an issue if you go the wrong direction in a conversation with somebody about healthcare, it can go about their experience or it can go about healthcare or about politics and the more political issues that really hinder us from changing our healthcare system. So we're going to be continuing to work across the country with other spokespeople and to really change the conversation to show where reforms are possible. Love to speak with people afterwards if there are opportunities in the states, in your communities, or other networks to drive some of these changes through our policy innovation or our political campaigns. So I'm happy to take questions from the audience.
Hi, Will Haskell, State Senator from Connecticut. Thank you so much. Could you go into a little bit more about prescription drug pricing transparency? What can be done at the state level? Obviously, so much of that regulation seems to fall to the feds.
Yeah, and my colleague here, Liz Hagan, we can talk about this afterwards because she's the policy expert. But we do really think there are levers at the state level to make sure that, as we think about different the Medicaid pricing between states and how can we make it more transparent about what states pay for different prescription drugs. There's prescription review boards, and we're actually Liz leads a table of a couple of different states where we can think about the different ways that we can price and make those more transparent. So I'm giving generalities right now, but would love to talk with you afterwards.
So I come from a healthcare background, and one of the problems that we often saw was vision and dental being carved out separately. So when you're talking about this, are you talking about full body health or bringing dental and vision in? And I see mental health, but are those two things something you guys are talking about?
Yeah, I mean, when you talk to people, especially, and that's where we center all of our work, it's crazy that mental health and vision and dental are all these separate things. And so when we, let me go back to the solutions. Especially on the solution 7, where we're talking about mental and physical health. It's how do we bring these together to make a more cohesive system for people. All right. All right. Thank you.
No problem. Got that? Okay, I think let's go ahead and bring Tashara and Will and Zach up as well, although Marcus will kick things off, but I think we'll get our panel up here as well, if that's okay with you guys. Thank you so much, Natalie. That was super helpful, and obviously reimagining healthcare, as you said, is such an important part of rebuilding in general. I wanted to flag in particular her comment about maternal and infant health. Obviously, we had one of our Ideas Challenge Award winners yesterday, Nima Kulkarni, who's somewhere here, won for an idea around maternal health, so I should connect you guys and make sure that you meet. But we're going to turn our attention now to a conversation, another important aspect of rethinking what we can rebuild in America around criminal justice reform. We're going to start with a presentation by Marcus Ellis. Marcus is the Chief of Staff for the Safer, Stronger DC Office of Neighborhood Safety and Engagement. He's going to help us kick off a conversation followed by this panel of distinguished New Deal leaders who are doing reforms in their communities to kind of rethink the criminal justice system generally, recognizing the inequities in it, as well as the fact that reducing crime cannot only be accomplished by law enforcement. That there has to be a more whole approach. So Marcus is a advisor to Cities United, which has put together kind of a comprehensive framework for thinking holistically about criminal justice and safe communities. So he's going to walk us through that, and then he will turn it over to Will Jawando to kick off our panel. So Marcus, thanks for being here.
Thank you. Appreciate you having me. First off, good morning, everyone. It's an absolute pleasure to be here today. I want to start off just by saying I'm a board member for Cities United, and I serve here under Mayor Muriel Bowser, as mentioned, under the Office of Neighborhood Safety and Engagement, where we focus on addressing violent crime from a public health approach. I'm a native Washingtonian, so for those that are not here not from the district, welcome to, this sounds crazy to say, welcome to my city, and we appreciate having you here. Just to kind of start off, so we're having this conversation right around reimagining public safety and what that could look like. We have done this one way for a really long time, and I think that collectively we might be able to say we have not accomplished the results that we would like to see. And so part of the Cities United mission, as you see on the slide, is this: we're committed to working with cities, community, and young leaders to reimagine what public safety looks like. I want to hone in on an important point that's on that slide as you read through that, and that's the youth voice, young leaders. At Cities United, what we believe is that We tried to solve this problem, resolve this problem too often without having the right people at the table, and that has included eliminating the youth voice. And so we have a keen focus on making sure that they are not just at the table, but have a voice that's valued and listened to and appreciated. Our vision, creating safe and healthy, hopeful communities. You can see our mission. Cities United supports a national network of mayors who are committed to what we're doing. We can't approach this problem of violence just by tackling it from your city standpoint. You have to form national coalitions in order to reach the goals we're trying to achieve. And Cities United has done a great job since 2011 in bringing mayors across the city together to support their efforts and help them to design a roadmap toward their vision and toward their plan. Our core values: social justice, equity, youth voice, collaboration, and innovation. This slide really speaks to some of the fatal and non-fatal violent crimes and victimization that we've seen across our city, across our country. This is why we focus on young Black men and boys. These are the most impacted by community violence, and they live in the communities that carry the heaviest burden. What we've noticed, as you can see, is that the numbers continue to rise, even during a pandemic. That's because when you talk about a population that is growing up in poverty, growing up without fair opportunities, growing up with systematic injustices, a pandemic is not going to slow down homicides. These are things that you can't see being a COVID-19, but what I can see living in communities such as the ones where we're seeing the most violence is what impacts me every day. Whether that be the walk to the store where I'm in danger, whether that be the trip to my school where it's tough for me to get there because of some of the things that I might be impacted by on my way. And so across the nation, sadly, we saw numbers of homicides go up during the pandemic. According to the Gun Violence Archives, you can see the numbers there. We have a high number of officer-involved incidents where the subject was injured or killed. We're talking about close to 14,000 of these incidents. What that says to us is that we cannot just attack this problem from one angle. Obviously, we have to stop the violent crimes that are taking place in communities, but there is a holistic issue to approach as it relates to community of colors and their relationships with law enforcement. The numbers speak. There's an issue there, and we have to address all of these things in a holistic way. So how do we do this? First, we want to interrupt. We want to get in front of a lot of the issues that are taking place. We want to address those underlying factors that exist. We don't want to just start right here where the problem is. We want to really look at how did we get here? What were some of the things that caused someone to decide to pick a gun up and use it to harm someone else? You don't just come out the womb thinking this is the way I want to live my life. There are things that existed that happened prior to get you to this point. And then we talk about dismantling systems of inequality. We have to, of inequity, we really have to take a look at the entire picture. Take a look at the school systems. Earlier in the presentation just before, there were so many overlapping issues that existed in the healthcare world that exist in the violence prevention world. That's not uncommon. It speaks to a lot of the systems that we're looking to attack. Invest in the sustainability of new administrative and operational activities. Key word there, invest. I'm happy to say that in our city under Mayor Bowser, we started off at the Office of Neighborhood Safety and Engagement, where I serve as Chief of Staff, with a $2.6 million budget 4 years ago. At this point, our budget is now 4 years later at $28 million. You can have all the great ideas you want, but without the proper investment in systems, in legislation, in resources in the communities that we're aiming to serve, you're not going to be able to get there. And so that's another message the Cities United carries across the country. Are you really willing to make the proper investments into the work we're looking to do? When I started my work in DC, well, I'm about to date myself. I've been in DC government for 20 years now, but when I started in this particular realm of work, Cities United came to Washington, DC. They sat down with myself, deputy mayors, chiefs of police, and what they did is they helped us create a roadmap. And that roadmap was really about addressing all the different entities that we need to touch upon. And so when you look at the roadmap, we're talking about things like hospital-based interventions. We're talking about religious institutions coming together to really look at this problem holistically. We're talking about diversion options, whereas instead of placing someone in an incarcerated environment, what else can we do besides put them in an environment that can pretty much become something they're accustomed to because they grow up in a system as such. And so I had the opportunity to serve as the superintendent for our long-term juvenile detention city here in Washington, D.C. And what I saw in that facility over and over again is that youth would be incarcerated starting at the age of around 13. They would come in and out of our system until they were about 21. At that point, that system and coming in and out of it is all that they know. And what I recognized quickly was that they were fine with it while they were with us. They were receiving 3 meals a day. They were receiving the love and attention that they deserved. But ultimately, they had to go back to the community. And when they went back to the community, we saw a tremendous digression in their progress. So what did that tell us is that you don't need to incarcerate. You kind of need to fix the situation that they're coming from, being the community. That's what we have to address. That gets back to some of these underlying factors that I'm speaking to. And so again, when I came to DC to do this particular work, Cities United sat down with Washington, DC, and they helped us design a roadmap. That roadmap led to the legislation that then created the Office of Neighborhood Safety and Engagement. I want to stay on that point if I can just for a second, and that's legislation. Understanding and respecting that I have several elected officials in the room, the legislation part is important because we need these systems, we need these offices, we need these budgets to stay in place beyond who's in the political seat. Folks come in and respectfully they have new ideas and new thoughts about the way they want to do things, but if we can get stuff legislated, it's not just a program, it's something that's instituted into the way we do business in the District of Columbia, which is extremely important. When we're talking about interrupting the cycle, we talked about it earlier, violence interruption. Violence interruption is something that we've invested in heavily to the tune of about $15 million here in the district. And I gotta be honest with you all, Cities United gives me the opportunity to speak to several jurisdictions about our work. And at times, you almost want to pull back when you're talking about your level of investment because so many cities just aren't getting these types of dollars toward what they have the passion, they have the people, but they don't have the money to support it. Violence interrupters are people that are on the ground, specialized skill set. They're doing what police officers are attempting to do, but they're doing it without a gun, they're doing it without a badge, they're doing it without a bulletproof vest. They're talking directly to individuals who have guns in their hands and are thinking about doing something with that gun. They're presenting them with options. They're saying, hey, listen, before you make that decision, let's talk about some alternatives that might work better for you. Let's talk about the results of what you might face if you do pull that trigger. Thank you. I thought I was talking louder. And so a lot of what, can you guys hear me well? Okay, awesome. So a lot of what we're seeing is that as we invest in those folks, we're able to get in front of a lot of the things we're seeing. I touched on it earlier, the hospital-based intervention. This is intervention that happens after, sadly, after someone has been a victim of a gunshot or a stabbing or something of that nature. Thank you. And so what we find from that is that we're able to get into the hospital, talk to that person while they're still there, while they're having the thoughts in their mind, perhaps retaliation or something of that nature. We can get in front of these obstacles. We can get in front of these challenges they might be facing, intervene, provide their family and their support systems with what they might need to move on in a more positive way toward their recovery. We talked about diversion and alternative plans. This is just really invested in other options. What else can we do with a troubled youth? in terms of how we serve them through resources versus incarceration. A coordinated response, and that's really having all these entities talking, not a siloed approach. And then collaborative public safety funding and models. This goes back to really investing in what we are aiming to do. Systems of inequality, I touched on these earlier. Boosting education, expanding healing center engagement, build on inclusive economy, reshape criminal justice systems, and bolster family support. This is a holistic approach. This isn't a cookie cutter approach. It's looking at individuals and really identifying what it is they need and what resources can assist them to be most successful. We touched on this, dismantling systems of inequity. You can see the model there that speaks to that. Really looking at the patterns that exist, taking a look at the structures that are created often that have been created by design, and really being honest with ourselves and having real conversation about how we can address some of what currently is taking place. We go back to investment, and for me, I'm going to hone in on this because it's such a key point. Really making sure that we understand, first of all, what is the cost? What is the true cost to public safety in looking at this in a different way? I think that we have budgets. We know what it looks like to fund a police department. What does it fund to do the work in a different way? What does it fund? What does it cost? What is the budget to reimagine this? Again, just going back to our roadmap, and again, for anyone interested in having Cities United have this conversation with you or your city, we are happy to come out to you. We hold a national convening each year, and I can provide more information on that. But this is important work. It's dire work. For us, there's been an epidemic going on far before the pandemic of losing young Black men and boys of color. And so we are committed to being a part of that change. We absolutely need the help of everyone in this room and beyond. And with that, I hope you guys will stay connected, and I appreciate your time, and I'm open for any questions you may have. Yes.
First of all, thank you for your presentation. Shalea Harris, School Board, Memphis, Tennessee. I looked on one of your slides and it said boost education as number one. What does that look like in practice for you?
Thank you for the question. And so when I think about boost education, I think about the fact that across the country, depending on your zip code, the level of education you receive might be different, even in the same city. How do we make sure that the opportunities, starting from a very early stage, and typically we're talking about pre-K3, equal the same opportunities as our counterparts in other parts of the very city that someone might live in? I think that it's about, one, it's about opportunity. It's about a fair shot at being successful educationally and making sure that we have equitable school systems kind of across our jurisdictions, ensuring that that fair opportunity is able to be met. Thank you. Thank you.
Is this on? There we go. I'm Kristen McCarthy-Vahey. I'm a state representative in Fairfield, Connecticut, and I think the topic of crime is one that we're talking about in every community, including my very affluent, very white suburb next to the largest, most diverse city in our state. And two of the things that you talked about, expanding healing-centered engagement and implementing asset-framed communications. I would love for you to talk a little bit more about that, because so much of this conversation comes from the place of the negative versus centering the voices of youth and focusing on their assets and how we highlight those and bring them in. So if you could talk more about what each of those mean, I would appreciate it.
Absolutely. I'll start with the healing-centered focus that you mentioned. A lot of this is about creating spaces for people to heal. We look at restorative justice practices. We look at healing circles. We look at providing opportunity within community to be able to really speak about any trauma, any adverse actions that you may have faced. And so what we're finding out is that for those who live in and are active in violent communities, the thought of treating and addressing mental health issues is a very taboo thing. And so we're looking at making sure that this becomes normalized, that you understand that the same way you would go to the dentist because your tooth hurts, you should go speak to someone when you're having internal issues with your thoughts and how you're processing trauma. And so understanding that it is a taboo subject, we have to be very strategic in how we get individuals who are culturally competent to come to versus asking folks to come to them to address these issues. And so establishing spots, and whether it be oftentimes in our cities, we have recreation centers. And I think we have to sometimes change the thoughts and how we use our spaces, community spaces, and make sure that we present opportunities in some of these brick and mortar areas for this healing to take place. Could you please remind me of your second question? Yes. And so you're absolutely right. A lot of what we promote is after an incident has taken place. And I think we do the same thing with our communication, the way that we communicate violence interruption and addressing this problem. And so you hit on it. That youth voice is important, because I think that what we get from that voice is an opportunity to see the light in the work we're trying to do. So there is so much that's happening on the preventive side of this, whether that be community gatherings, whether that be the opportunity for folks to come together and just think positively about how they're changing their communities. And we got to kind of own that in our work. I think because of the what has been a lack of overall attention to reimagining the way that we address violent crime, we haven't, almost in our haste, we haven't done enough to focus on how do we positively bring this message to light. And so I appreciate the question, and I take the note just in terms of how do we continue to highlight that. Thank you.
Thank you. Lorenzo Sierra, State Representative, Arizona. Now, before I became state representative, I was in a city council, close to 100,000, second largest Hispanic majority city. Some of the things that we did there was we made sure that our police force reflected what the community looked like. Our police chief right now is a Hispanic male who grew up in that community. Mm-hmm. And we take great pains to make sure our officers reflect the community. So we've actually done that recruiting. We've actually started going into the high schools and making sure. Now, one of the things that I've also done is I've also made sure that we established relationships with the police force with the kids in some of our rougher neighborhoods, because I would rather have the relationship start in, when they're doing back to school things or we're doing our Christmas things, instead of having the first interaction being they came to get dad or they came to get big brother. But the one thing that I think is probably most powerful in what we've done is we have zero tolerance in regards to race issues. And one issue came into the media, so I'm able to talk about it. One officer had called a black officer's wife a gorilla on Facebook. No questions asked, fired. And part of that is because there's systemic, and I don't want to make that accusation, but there seems to be, in my opinion, systemic racism in police forces. And if there's no repercussions, then that will fester and continue to thrive. How have you worked with your police forces to make sure that they're getting the training they need to be more culturally competent, like you just mentioned? Because I think that's one of the key aspects of it?
Again, appreciate the question, and I got to say that a lot of what you all are doing, those are the right steps. Those are the right steps to eradicate something that has existed, and you made the, you kind of made the statement. You're right. That does exist in police departments across our country. We just announced yesterday through Mayor Bowser a plan to hire 150 recruits that are from the District of Columbia. Now, what you notice from that is that me being from Washington, D.C. and growing up here, more likely than not, my level of anxiety towards those that I'm looking to serve is just not going to be as high. There's going to be a correlation with the fact that I'm familiar with your community. I'm familiar with the high school you went in. There's something that exists there that is a very real thing. And what you mentioned, if putting bullets could be a part of this slide deck, right? These are the steps that we need to take and we need to be intentional about. Look, I am not, Cities United is not, Mayor Bowser is not of the opinion we need our police forces. That is not where we're coming from with this. They have a role in this. We have our role. However, as I mentioned on one of the slides earlier, if we don't address both, we will continue to be in this revolving door that we've seen ourselves in for centuries now. So thank you. I appreciate that. And I appreciate what you all are doing in Arizona.
Good morning, everybody. Let's give Marcus another round of applause. Thanks, Marcus. Appreciate you, man. He's doing great work. Followed it. Cities United is a great organization. So I'm the co-panelist moderator with my group here. So I'm gonna introduce my co-panelists. I'm gonna give a couple minutes of remarks on the work that we've done, and I'm gonna stand up here so you guys can see too. And then we'll get into a conversation. This is obviously an important set of issues. I think the question that we just had about no matter what city you're in, what the demographics are, this is an issue, right? And it's being made an issue politically, and we know that that has happened before and it's happening now. So I'm Will Jawando. I'm a council member at large in Montgomery County, Maryland. We're the largest jurisdiction in the state of Maryland, 1.1 million of our 6 million residents. We have 4 of the top 10 most diverse cities in the country. We're 52% between Black, Latino, and Asian, about 20% Black, 20% Latino, 12% Asian of all types. I was honored to win the award yesterday for the use of force policies, which I'll talk about later. Yeah, you don't have to clap. That's all right. I appreciate it. We've all done great stuff. I'm with, you can clap for my co-panelists, St. Louis Mayor Tashara Jones, who was, I'm gonna give you a little, just 30 seconds, sworn in as the 47th mayor and the first Black female mayor in the history of St. Louis on April 20th, 2021. And she has worked as the treasurer, she has worked as a state legislator. She's got a whole bunch of experience, and she's just an awesome person. And I know she'll talk about her community's first approach and what they're doing in St. Louis. Also want to introduce, so we gave her a round of applause, but let's do it again, one more time for Tashara. Also want to introduce Columbus City Attorney Alex Klein. Did I say? Zach. Why does it say Alex on my seat? I'm going to kick someone's. Josh, okay, it's Zach Klein. Sorry, Zach. Zach is the attorney, Columbus City Attorney, and has served in that position since 2018. And he was on the Columbus City Council, including president from 2016 to 2017. And he's been really leading the charge on diversion, on appropriate prosecution. He'll talk about all that. I'm sure he's done many other things, but making this system more fair. And it really is a system. I really appreciated Marcus's slides of showing that whole system. I saw a lot of people taking pictures. This is a systemic issue, and it needs systemic solutions. And I think today we'll talk about several points in time. So please give Zach a round of applause. Okay, so I'm going to just do a couple minutes on what we've been doing, and then we'll get into the conversation. I'll turn it over to Shar and then Zach. Reimagining public safety, like what does it mean, right? The term gets thrown around. It's kind of like equity right now. Everyone says it, and everyone has a different meaning. For me, I think the presentation you saw is a part of it. We have to work on every part of that pipeline. What are the root causes? How do we keep people safe? You know, how do we deal with the fact that there's more guns than people in the United States? And that I'm sure in your jurisdictions like mine, that even went even higher during the pandemic. Gun sales skyrocketed, right? And how do we deal with that? And then also, how do we deal with the legacy of systemic racism and inequity that is really at the root of our criminal justice system, right? If you talk about the origins of the police force in the South in interactions with black people, those were slave patrols. You can go to the African American History Museum and see the actual badges that were organized in the Carolinas in the 1700s to round up escaped enslaved individuals. That is the first African American interaction with the predecessor of law enforcement. In the North, they were used to bust unions and a whole bunch of other things. So you have to understand that history of policing and criminal justice if you're going to talk about where we are today. We've obviously morphed into a system of mass incarceration where we incarcerate more people than any other place in the world, disproportionately black and brown residents, right? Just to give you an example, in my county, black residents make up 19% of the population. They account for 50% of the arrests. They account for 55% of the people who have a use of force interaction with police. Our juveniles arrested in schools, 50% African American. If you add Latinos, you're 75% of the people arrested. When you dig into what they're arrested for, the vast majority of our arrests in Montgomery County, and this isn't true everywhere, are low-level arrests. Disorderly conduct, low-level drug possession, resisting arrest, things that other people might not be getting arrested for, right? We all know, for example, marijuana usage is, some studies have suggested it's even higher in white communities, but it's at least the same as it is in black communities. But we know who's arrested for those things. So you have to tell the truth. In my city, in my county, I'm spending a lot of time on the data because I think the truth telling of it is so important to build the political will to address the really hard stuff, right? No, most people, if you're in a good city, you're not going to argue about investing in recreation and after-school programs, even maybe diverting some calls. We're having trouble with this, but mental health, people who are experiencing homelessness or dealing with a mental health crisis, diverting some of those calls or having co-deployment with police. But you're really going to I've had an uphill battle, and I think many people have an uphill battle with saying the system, the way it is designed and implemented and set up, is set up to produce inequity. You have to show people the data to understand that. You go to traffic stops in our county, I'm sure similar numbers, and I say all this because you should know these numbers. I think we all have to know these numbers because you cannot attack it from a racial equity lens if you don't, and you can't change the system of policing unless you know and can demonstrate what's going on. You're 3 times more likely as an African-American resident to be pulled over in our county. In a place like Bethesda, and it's one of our wealthier, whiter areas, it's 80% white, you're 7 times more likely to be pulled over as a black resident as in Bethesda as a white resident. And it's 80% white, that community, right? I mentioned the arrest statistics. I think we got to talk about that. So what do we need to do? I'll spend my last 2 minutes and turn to Shashar on that. I have a theory of the case that I would propose to you that we need to do 3 things all at once. In addition to everything that was on that chart, making those investments, I'm going to focus on the policing side because I think it's really hard. And for all too often, it's been like, well, just let them do whatever they're doing. And we haven't really had a lot of influence on it. We need to shrink the size and scope of what police focus on, right? We need a more focused, more highly trained, and more accountable police force, right? I agree with Marcus, we need police. I'm not on we don't need police. But what we need is we need the right folks from the right communities with the right backgrounds and training that are paid well. So, you know, the defund people love me until I say we should pay our police more. We absolutely should. Just like teachers, we should pay people what they deserve to do the right job, and then we should hold them accountable. But we don't need them in schools. We don't need them in an enforcement capacity. After school basketball, okay. Patrolling the halls, not okay. right? We don't need them responding when someone's peeing on the side of a building or dealing with a mental health crisis that's nonviolent. If they do respond, they need to be co-deployed with a crisis intervention counselor, right? In Eugene, Oregon, if you heard of the CAHOOTS model, 40% of their calls diverted into 911 to a non-police response, right? I know we don't, do we have any Oregon people here? I think we have someone from Oregon. Yes, there you go. All right, yeah, Oregon. We are consulting with them. They're coming and helping us, and we're building out our Crisis Now model. There's other models. Baltimore has a model. DC's working on a model, but that type of model. Then you need to have strong accountability. When people do things wrong, the unions shouldn't get in the way. They should have the same rules as anyone else. You should be able to exit them and discipline them, and it should be transparent about what they did. And that is a problem as well. And I think you got to do all those things. You have to hire the right people, narrow their focus, support them, and then hold them accountable. And I think there's a lot of things within each of those, but I'll end with this. The use of force bill that we passed, it raised the standard of when you can use deadly force from reasonable, which is the Supreme Court Graham standard, to necessary, right? As a last resort after you used other alternatives, right? After you de-escalated the situation. So the courts will have to decide what that means in relation to the Graham standard of reasonableness, but it's clearly a higher standard that we've defined. And I think that's important because we give our police a lot of power. We give them the right to deprive people of life and liberty, to take their lives. The county, the community, the state should be able to decide how that power is used. And that's what we won the award for. It was a big fight to raise it. There's some federal legislation that's seeking to do the same, the Peace Act, which has not passed. Obviously, we haven't had any criminal justice reform to pass. If you think about all that happened with George Floyd and Breonna Taylor and all the people who have died and all the global protests, we still have not passed a federal police reform bill. That shows you how intractable these problems are. And that at the local level, it's even more so, I think, because that's where the rubber hits the road. And those 18,000 police departments and agencies where you're trying to change culture that's been ingrained for hundreds of years. So I think we have all of a role to play, obviously, and I know you're all trying to do it. I'm going to turn it over now to my sister, Tashara Jones, to talk about their approach in St. Louis.
Thank you. Thank you, Will. You just stole all my thunder. No, good morning, everyone. It's so good to be in person again after being virtual for so long. As Will mentioned, I'm the 47th mayor and the first Black woman mayor of the city of St. Louis, but I'm also the first mayor in over 20 years to be born, raised, and still live in a predominantly Black neighborhood in the city of St. Louis. So many nights, my son and I fall asleep to the lullaby of gunshots in the distance. And my son has almost been a victim of gun violence twice in the last 5 years, as well as I've lost several relatives to gun violence. One just back this past summer in August. She was 27 years old. She was 2 months pregnant and was literally at the wrong place at the wrong time with the wrong people and lost her life due to, a fight. So it's personal for me, and it's personal for people across St. Louis, and that's why reimagining public safety is my top priority as mayor. Maintaining the status quo cannot continue to govern St. Louis, and we have to be innovative in our approach to keep people safe. My goal is simple. I want St. Louis to win again. I want residents to thrive regardless of the color of their skin, who they love, or how they worship. Their zip code should not dictate their quality of life or their opportunity. So I'm working to right historic wrongs that have left entire neighborhoods, entire parts of our city disinvested and discouraged for decades. And that's the vision that I'm using as I try to improve public safety in St. Louis. So I want to start by sharing our 3 public safety principles that we are using to guide our discussions. So first, our first principle starts with using smart on crime strategies to ensure that we can prevent and address crime when it occurs. We prioritize innovation to achieve better outcomes and ensure that our residents and visitors are physically safe. Our second principle prioritizes healthy communities. We talked about healthcare earlier. We cannot ignore the intersection of healthcare and gun violence. We are also in the process of declaring gun violence as a public health crisis. And the third principle is responsive governing. The people closest to the problem are closest to the solution. So it's our responsibility to listen and be accountable for their concerns, and they are our biggest partners in addressing public safety. Like most cities, St. Louis experienced an uptick in crime in our downtown or our central business district. So along with community, business, and civic leaders, we launched the Downtown Engagement and Public Safety Initiative. As the old saying goes, an idle mind is a devil's workshop. Well, an idle downtown is a troublemaker's paradise. And that's exactly what was happening in our downtown during the pandemic. Our streets were bare, there was nobody around, and so our young people started shooting out the windows and using those scooters, going everywhere and really terrorizing people. So it was an innovative cross-sector approach to activate our downtown so everybody feels safe and welcome. So we temporarily added 30 new officers to a patrol beat on the weekends. But our number one goal was this wasn't an either-or proposition, it was a both-and proposition. We can protect our assets downtown and provide safe and fun activities for our young people. Because when I was growing up, not too long ago, there were things for our young people to do. They had teen clubs, they had skating rinks. All of those things are closed now. And so what are they going to do? They're going to get in trouble. They're going to find something to do that may not always be productive. So it's a both-and approach. Protect our assets downtown, but also doing things to engage our youth in fun and safe activities. So we've done a cypher downtown, which is what I understand is a rap battle. Y'all knew these millennials use new words now. We've done painting with them, so we're using arts and culture as well. And we're also in the process of setting up some winter activities to help them use their creative skills to make their own demo records using one of the studios downtown. So all of these things address crime at its root. And so, like we talked about Cahoots in Oregon, we allocated $5 million in funding for cops and clinicians. It's a co-responder model that dispatches behavioral support specialists to mental health crisis calls to take the burden off police. So out of the over 2,000 calls that cops and clinicians has responded to, 98% of the people they've encountered have been diverted from jail. So this type of diversion works. We also invested an additional $5 million in cure violence and other community violence intervention programs. Just a note here, your ARPA funds can be used for community violence intervention programs. This program hires and trains people from the community so they can help de-escalate violence as violence interrupters like Marcus talked about and prevent violence before it starts. We have that in 3 neighborhoods and we'll be expanding that using the money we are allocating from ARPA. And lastly, as you saw on TV or Beyonce's internet, Mayor Quentin Lucas and I were having a press conference after we did a roundtable about gun violence, and gunshots rang out like mere yards away from where we were standing. And I didn't flinch because I have, Stockholm syndrome, living in a community where I hear gunshots more often than not. And sadly, it went viral, but I've become so desensitized, and many people in my city have also become so desensitized to gun violence because we have more guns than people in our country. But when I got home that night and I showed it to my son, he thought they were shooting at me. And so he shouldn't have to grow up with that sort of trauma as well, with his mother being mayor. So a couple of other things that we're doing, we're adding 28 social workers to our city city payroll or our city's workforce to support our unhoused, reentry, and victim support. This is part of a new program we're calling Social Workers for St. Louis. And we talked about again, how many we have more guns than people. A lot of this is due to, our state's preemption in gun laws. From 2007 and on, they have been constantly relaxing our gun laws and have tied the hands of local municipalities to enact common sense gun safety on the local level. So gun deaths in 2019, Missouri had the 6th highest gun-related death rate in the country, not just in the state, in the country. And recently, you may have seen on 60 Minutes, they passed the Second Amendment Preservation Act, which prohibits law enforcement from enforcing federal gun laws. And sheriffs from across the state have spoken out against this horrible law, and we are currently suing the state to overturn it. So that's a lot. It's what we're up against, and the state makes it difficult for us to remove guns from our street, but that doesn't mean that we're not using the other tools in the toolbox and everything that we can to address gun violence at the root cause. So look forward to this conversation.
Thank you, Char. Zach, you are up, sir.
Well, thanks. I'm Zach Klein. I'm the Columbus City Attorney. I know in talking to some folks, a lot of y'all were kind of surprised that I was an independently elected official. Because especially folks who have a municipal background, their city attorney or law director is typically appointed maybe by the mayor or the council. Much to the chagrin sometimes of the mayor and the council, I'm independently elected and I don't work for them, which is great for me. But so Seattle, San Diego, Los Angeles, and Columbus are probably the 4 largest cities in the United States that have independently elected city attorneys. So the role that I play as is pertinent to this discussion is, one, I'm a prosecutor. I have about 177 people that work for me, half of whom are in the criminal division. My jurisdiction is all misdemeanor crimes that occur within the city of Columbus. We do not do juvenile. I do not have juvenile jurisdiction. So it's a busy court. We do about 110,000 cases a year. That's everything from traffic all the way up to something very serious like domestic violence. The other pertinent role that I play is, among other things, one of my clients is the Columbus Division of Police. So it's an interesting perspective of understanding and working with the police. They do not report to me. They report to the Department of Public Safety Director and then to the mayor. But having the influence to work with any sort of client, in this instance, the police, to be able to influence change. So when I ran for Columbus City Attorney, I started with the premise of how can we rethink and reform the criminal justice system, as prosecutors, things that are directly within my control as the prosecutor in the city of Columbus, because I believe in the adage of you do the same thing over and over again expecting different results. That's been the criminal justice system in our country for decades. And we've seen the same results over and over again without any significant change for not only the victims that are victimized, but also the actual true community safety that we seek to preserve and protect. So some of the reforms that we've made that were within my control are we eliminated cash bail for all nonviolent misdemeanors. We stopped the prosecution of misdemeanor marijuana possession in the city of Columbus, even though it's still illegal under the Ohio Revised Code. I had that discretion as a prosecutor. I told police, stop bringing me the cases. We're not doing them anymore. We also, working with the Division of Police, created a policy that favors summons over arrest for nonviolent misdemeanors, so that we're not filling up our jail for nonviolent crimes. It's issue a summons. I brought charging decisions away from police in-house that my team reviews before we charge people with crimes, to make sure the facts are tight, to make sure they fit the crime, and that way we don't have to worry about overcharging folks. And if we have any sort of bias of overcharging, the buck stops with me as an independently elected prosecutor, and the voters can vote me out. We also, one thing that I'm most particular of is we took a step back and asked a very complex question a very simple question that produced a complex result, and that is with nonviolent crimes that are in the courtroom, asking why. Why is this person in the courtroom? Why did he or she steal? We created a program that's the first of its kind in the country, that's a diversion program, so we heard about diversion, that is a pre-charge, it's a pre-charge diversion program that identifies and treats the root reasons of crime. We talk a lot about drug addiction and mental health, and we certainly screen for that because it's very important. But what makes our program unique is we partner with a third-party healthcare organization that then does a 32-question in-depth screening of that defendant that asks about drug addiction, mental health, but it also asks about transportation, food insecurity, housing, employment. And then each individual defendant gets a tailored plan specific to his or her needs as part of the diversion program. You know what the number one thing folks say the reason they steal is? Anyone have a guess? Hungry. Food. So in working with our food bank and our local food pantries, literally part of our diversion program is where do you live? Did you know 2 blocks down the road is a food pantry? You don't have to steal. We had a mother steal a mattress, a baby infant mattress for her child. We have a significant and robust infant mortality task force and program in the city of Columbus. Connected her with those resources. You don't have to go steal that mattress from Target. So it's really, from a community safety standpoint, if you're really going to tackle recidivism, you have to step back and treat those underlying reasons why that person's committing a crime. Otherwise, it's that same thing of doing over and over and over again and expecting a different result. The pandemic hurt that program a little bit because the court system shut down. We had to scale back. So we took about a 14-month period off. We resumed it again. We've had about 170 people go through the program over the past 2.5 years. Again, 1 year was suspended. We've had 6 people reoffend. There isn't a criminal justice program in the country that is that successful. And I'm proud of the work that we've done in that space. And I really believe that is the future of criminal justice, is taking the time and developing plans that are specific to individuals to break that cycle of criminality, not because they're bad people, because they need help. And it's the public health aspect and approach of how we prosecute cases. On the flip side, being the lawyer for the Division of Police, and then I'll sit down, we've trying to be as influential as possible in reshaping how we police in the city of Columbus. We had protests and riots in the city of Columbus that did make national news. I was not proud of the way that the city of Columbus and the Division of Police handled the protests. I wasn't proud of the way that some of the protesters treated property damage and the way they treated the Division of Police. So we, under my discretion, appointed an independent prosecutor to prosecute independent prosecutor and independent investigator to prosecute those in the Division of Police that broke the law and assaulted individuals. At the same time, we prosecuted folks who committed violent crime and violent acts against others who were protesters. And then working with the Division of Police, we've also created a community immersion program. Going back to the question of having police officers, represent and look like the community that you serve. I grew up in rural southeastern Ohio, right on the river across from Parkersburg, West Virginia. When Parkersburg got an Outback Steakhouse, we were pumped, right? And now I'm the city attorney in the 14th. What's that?
Bloomin' Onion.
Yeah, well, I was more of a cheese fries guy. But now I'm the city attorney in the 14th largest city in the United States, represent almost 1 million people. Most of the people that become Columbus Division of Police officers, they look like me and they're from where I came from, rural Ohio. That doesn't make them bad people, but certainly their perspective and the impressions and the stereotypes and their interactions of people of color, of the LGBTQ community, it's limited, it's different. Because maybe their only exposure to those select groups of people are what they see on TV or what they see on the internet. They have no real exposure growing up in towns that are 99% white. So we created an immersion program that before you get a badge and a gun, you go out in the community and you serve the community. You get to know who the community leaders are, get to know who the faith leaders are, understand the historical aspects of our neighborhood so that you're not hitting the ground with a badge and a gun on the day one with these predisposed ideas of the people that you're serving, that you're like, well, I met that person. That's, Pastor so-and-so, or that's Mrs. so-and-so over at the Driving Park neighborhood. And it drives that kind of grounding and understanding that is so important to actually serve the people that you're protecting. I'll stop there because I want to be able to answer questions, and I know that a lot of folks want to hear from our great leaders too. But thank you for all the great New Deal work that y'all are doing. I'd be happy to talk more about other things that we're doing, but I appreciate everything that y'all done.
Awesome. Yeah, and I think we have about 15 minutes for one or two questions. Okay, we have one or two. I'm going to go there and there. I'm going to steal three. I'm going to do three. Okay, go ahead.
Thank you, and I'm sorry, I feel like I'm still in the turn since I presented, but I got to do it. First of all, this is more of a statement. One, Mayor, thank you for what you're doing in your city. Thank you for what you're doing in Montgomery County. I think that, however, your statements were most profound, because to be quite honest with you, we need more people who did not grow up hearing gunshots outside of our windows to get it, to promote it, to understand it, and to make change. And so, you know, I grew up hearing those same gunshots, lost a brother to this, right? I'm going to always get it, but you getting it and spreading this word is extremely important, so thank you.
Absolutely. Couldn't agree more.
Okay. Mayor Jones, hey. Could you speak a little bit more about the ARP program, the Community Violence Intervention Program?
Yes, so the city of St. Louis is part of a cohort of about 16 cities working with the White House on community violence intervention. We used ARPA funds for community violence intervention programs, but also the Build Back Better Act has $5 billion set aside for community violence intervention. And so we are putting money in cure violence and other deterrence programs to make sure that we are trying to address crime as it happens at the root cause, putting violence interrupters in neighborhoods. So we started Cure Violence back last year. We're also doing a pilot with Focus Deterrence and using all of those sort of violence interruption tools to see what we can do on the super local level to make sure that we're interrupting violence before it starts.
Just one more. I want to give a big plug to what Zach said. The data on the prosecutorial side often gets overlooked. Like, who gets diverted, right? We just can put a Office of Legislative Oversight, which is our investigative arm, to our state's attorney, whom we fund. He's duly elected, but we fund his budget. Who's diverted? We have great diversion programs. Who's going there? Who are you charging at what level? There's almost no transparency on that data nationwide. And I would just urge you to dig into that in addition to the police side data, because it's really a continuum. All right, one more. Anyone? Okay, right there. Last one. Thank you.
Thank you. Could you speak at all to any components of your programs that are focused on supporting individuals that are not documented?
We don't have any programs per se, but we have an excellent relationship with the Defense Bar, and they know to come to us if the individual is undocumented, and if folks fear showing up to court because of deportation, then we will work with them to make sure that we are not part of that process to get them deported. We still want to promote accountability for misconduct, especially for violent crime, in particular domestic violence, but working with criminal defense lawyers to understand like how we can solve the issue before us without having for their family and friends to live in fear of deportation.
And we also don't coordinate with ICE in our city. I know that can be controversial depending on where you are. We don't hold people. We notify required as law, but we don't hold people. We don't try to make sure we pass people off. And then the other thing I'll say is on the street, we have a street outreach network. We have a large Salvadoran population, largest outside of El Salvador. 20% of our folks are Latino, but the largest chunk is from El Salvador. And so we have an MS-13 presence. And we have a lot of unaccompanied minors that have come over the last year, especially in this last wave, that are coming to our school system. So we have a particular program, and I've hired people that focus on not letting them get recruited into violence, which is a huge issue when you come over and you've got family back home. And I think, again, that's just tailoring to your community. I know that's not exactly what you asked, but it's an issue that we're seeing, and I'm sure maybe others are seeing too. All right, I think we're done. Thank you, everybody.
Thank you so much to Mayor Jones, City Attorney Klein, and Councilmember Jawando for all of your insights and perspectives on this important issue. It's been a really great morning thinking about these huge policy challenges, and I'm sure you're all ready to get into more. We're going to head into breakouts now, where you're going to be able to participate directly in these discussions. And there's 3 options. On the second floor in Classroom A will be a group on climate financing. In Classroom B, right next door to that, will be a group on the problem of student debt. And then here in this room, a group will discuss anti-poverty strategies. We've got 2 really great keynotes that will wrap us after that. So return here at 11:20 a.m. to hear remarks from Congressman Adam Schiff before we wrap with Diane Hessen, the author of Common Ground, and Professor Ryan Enos, who is the author of The Space Between Us. So one more time, your breakout options are climate financing in Classroom A, student debt in Classroom B, those are both on the second floor. And then right here will be anti-poverty strategies. We're tight on time, so please head straight to the breakouts and so we can ensure there's plenty of time to discussion. And we'll see you back here at 11:20. You're dismissed.
All right, so with 10 handouts, we don't have.
If you're staying in this room for the anti-poverty breakout, please go to the table in the middle.
What's not?
Yeah, it's not on.
The bottom floor? Oh, yeah, what about the bottom floor? Yeah, that's right there. So the bottom floor don't work? All 4 of those that helps.
Huh? I think we have 4 discussion leaders in this one. Oh, yeah. If you are staying in this room for the anti-poverty breakout, please come and sit at the table in the middle. If you are not here for the anti-poverty breakout, please head to a breakout or keep your conversations quiet out of respect for the breakout discussion. All right. Starting.
I don't want to take a seat away from the leader, so.
We can add more chairs if we need
But
to.
I'll just hover into my people.
Thank you, everybody. Monique?
Yeah, hi.
Derek Green.
Oh,
How you
nice
doing?
to meet you, sir.
Yeah. Good morning, well, it is still morning. Good morning, everyone. If we can get started for this breakout session. I know we have a lot of movement around us, but we're going to have a good conversation, which I think really dovetails off of what we're hearing this morning. My name is Derek Green. I'm an at-large member of City Council in Philadelphia. And we have a really great panel of speakers to talk about the issues of poverty and anti-poverty strategies, and we'll talk about some trends in California and across the United States. We'll also talk about some outstanding ideas that you can see at the state and local level, and I'll talk about some of the work I'm doing in the city of Philadelphia. But when you think about the conversation we've had this morning, talking about healthcare and public safety, it's all interconnected to poverty. I know in my own city of Philadelphia, and I'll talk about some of the key stats, but one of the big issues we had last year was that we had 499 homicides. We also have a 25% poverty rate. I think there's a direct connection between the amount of homicides and gun violence in cities around the nation directly connected to poverty. And if you listen to the remarks that President Biden has made about this K type of recovery, I know from my own experience as an attorney and as chair of the Finance Committee and City Council, I talked to a lot of either managing partners and CEOs, and there are a number of people that did okay during the pandemic. Some did a lot better than anticipated, especially in professional services areas. But then we had a whole number of people who really struggled through the pandemic and are still struggling to this day. And I think the pandemic really just illuminated some of those disparities and made it even more and more prominent. And that's why talking about anti-poverty strategies is so important at the state and local level. So the bios of our speakers, I think we're in your materials. So I know we only have a limited amount of time, so I don't want to go through all the bio information, but we really do have a great panel. So we're going to start with Amy, who's going to talk about the work she's doing in California and some, California and U.S. trends. And then we'll have Monique give some perspectives, and I'll close and then give some Q&A. So that way we can have a great conversation.
Awesome. Thank you so much, Derek. And good morning/afternoon, depending on what your time zone is. I'm Amy Everett, and I'm the president of Golden State Opportunity. It's a 5-year-old nonprofit that was created to help low-income workers create financial security so they can thrive. One of the core programs that we have run for the first 5 years is around the Earned Income Tax Credit. How many of you have heard of the Earned Income Tax Credit? Okay, great. That's why you're here. I came from about 20 years of democratic politics and reproductive rights work. So when I came to this anti-poverty space, I have really new eyes on it. I have not been in this space in a policy sense. And I want to share with you all some of the things that I have found in this space that really need addressing. One is that, and I don't think this will be a surprise to anybody here, but poverty has been a policy option at the state, federal, and local levels for way too long. What I see in the broken system that we have created, that's our social safety net, It's a great in theory, but it is derived from the false narratives of how divided our country is. You have people who think, you know, when I worked in reproductive rights, everybody had their judgment about why women or people would get abortions, who they were and why they did. And I was shocked to find the same thing when I talked about poverty. Who was poor and why they're poor? Everybody has their stereotype. And I sat there for the first few months. By the way, I started 3 months before the pandemic. And I thought, wow, all of these stereotypes, lazy people who are gaming the situation, don't want to work, people who are victims, and we have to help them because they can't help themselves. I'm like, I don't know who those people are. All I see are people working really, really hard at 2 and 3 jobs, trying to put food on their tables, trying to make ends meet. Where are the policies for those folks? Because if we're only making policies for the tail end of a bell curve, you're punishing everybody else in the process. So we have this broken system. What really struck me was when you are if you fall on financial difficulties, when you experience poverty and you go into the social safety net, how many people here have heard of the benefits cliff? The benefits cliff for folks who haven't is when you're getting benefits and this is designed for you to get a great job. So a job. So you have a job, you're doing well, your boss is like, I want to give you more hours, I want to promote you, I want to give you a raise. And you have to say, please don't. Because if I make a couple dollars more, I lose all the other programs that actually have enabled me to hold down a job. And that says, you can work, we just don't want you to succeed at work. And that is a broken system. And so what we are working on right now at GSO is how do we make this broken system that exists right now better, but we're just honestly putting lipstick on a pig. What we're really focusing on is how do we fundamentally transform the programs so that we can make them work for the people who need them when they need them, but not tether them to a system that's going to keep them from being successful. One of the solutions has been around since 1975. It's not new, but it's really effective, and that is the Earned Income Tax Credit. And now you've probably heard a lot more about the Child Tax Credit. In California, we have our own EITC. It was brought by our founder. It's called the Cal EITC, and we have a Young Child Tax Credit. And this is one of the largest cash transfers in America, and it has so many proven impacts to end poverty or to help mitigate people who are experiencing poverty. Better health outcomes for women, especially pregnant women, better educational outcomes for families with children, better mental health outcomes for folks who experience that toxic stress of financial insecurity. There is still room for improvement on that. We were happy with the Build Back Better plan, but it had everything, including the kitchen sink in it, and a lot of that has been taken out. So we still have a lot of work to do. But I want to talk for a moment not only about, I talked about how the EITC, what it can do for an individual, but I also want to talk about what it can do for a community. Because when the federal EITC or a state EITC is received, it goes right back into the economy. These are not folks who are saving money for a rainy day. These are folks who are paying their credit card bills, they are buying gas, they are buying groceries. In California in 2019, what we found is that between the federal and the Cal EITC, it helped sustain 75,000 or sustain and create 75,000 jobs in California out of the 300,000 new jobs that were created in California in 2019. It created $219 million, went back into the state general fund. This is from sales taxes. This is from just the economic activity. And the total activity was $14 billion as that money cycled around and through our economy. So when you bring the EITC, when you increase the uptake of it, because what happened in California is that we were leaving $2 billion at the federal level. And when we started our programs, we started drawing down about $400 million a year over the last few years. And that was creating a lot more financial and economic activity, which, as we all know, to the K that you were talking about, that's the level where we need the investment is at the local level. It is trickle up, and that is a much more effective economic theory than trickle down. So I'm trying to convince you that the EITC is pretty amazing. So let me leave you with 3 or 4 things that you yourselves can do. One, if your state has an EITC, how many of your states have an Earned Income Tax Credit? A few of you. So my suggestion is work to expand it. Make it bigger, make it more inclusive. If you don't have one and you have a federal one, really what we spend a lot of time at GSO doing is educating people, communities, about it, because this is, as an elected official and a local elected official, you can go to your constituent and say, I want to help you put more money in your pocket to help you buy the things you need. And so I'm going to suggest in this upcoming tax season, do webinars, work or in-person tax events, join the VITA, the Volunteer Income Tax Assistance Programs. Make sure your constituents know about it. If you need materials, if you need assistance doing that, we're happy to help you, give you what we do. We're happy to participate. One of the things that's really important, if you're going to do outreach, I don't know if you can, so you should check this, but if you can use your ARPA funds to do education and outreach around this, just make sure the materials you put together are actually culturally appropriate and they're in multiple languages that are appropriate to your community. And make sure you're working with trusted messengers, the CBOs on the ground who are already working with folks who are trying to get services. And then advocate for, and if you don't have one, advocate to get a state EITC. As I said, you can make the case for why it actually creates economic activity. It's for people who have already earned money. They're folks who are working, so that works. And then if there's one message that you yourselves can leave here with, I'm gonna say this again, which is that poverty has been a policy choice, and America can no longer afford it. It needs an expiration date. And I think that the folks here are going to have ideas, and I'm happy to talk more about what you can do around either it's the earned income tax credit and the child tax credit and getting more people to claim them, or other policy programs to end poverty. So, thank you.
Thanks, Amy. I feel like we should clap for you. Okay. Thank you. My name is Monique Garcia-Reiser, and I'm a vice president at Friedman Consulting. We're a firm based here in DC that works with philanthropists, nonprofits, and policymakers on strategy, communications, and policy planning. But before I came to Friedman, which was only a couple of months ago, I ran a nonprofit here in the city, working with young people on work-based learning experiences. I oversaw our programs in 6 school districts and served about 800 youth. And then previously ran a national coalition that did research and communications on economic opportunity. I feel like it's important to mention too that I'm also somebody who experienced this journey from poverty to opportunity. I was a first-generation college student, I was a young parent, and I'm the result of a lot of things and policies that helped me get to where I am. And I just think that's important context for these conversations. I think someone was talking about lived experiences before. So I'm going to talk about 3 areas that I'll try to get through quickly. I think I wrote far too long, Amy, looking at your notes, that we've been engaged with at the firm. And so the first one is picking up on tax credits. Of course, you know about the child tax credit, but you also probably know that it's a lot of children have been left out of it. Now, while the monthly payments deadline has passed, there's still an opportunity to get that 2021 tax credit. And we really encourage you to work with your local nonprofits to make sure those families who are undocumented or speak different languages get this advantage. I mean, I'm sure you've seen this, but I feel like it can't be said enough that this is like right now the lever to pull to get children out of poverty. And there's still a lot of people who don't know about it. And of course, hopefully, this will be extended, but there's still time to give some money back into the pockets of these families for 2021. The second area I wanted to talk about is give some examples of how some cities are using those ARPA funds. We worked with Johns Hopkins looking at 20 cities and what they were doing. And so I thought I'd share a few trends that we found. So amazingly, 75% of these 20 cities were using their funds in 3 major ways: replacing lost revenue, household and family support, which included housing, and homelessness and housing. And there was significant investments in homelessness and housing in some of these communities. And then a few interesting ideas that we found that I'll share here. And I don't think anybody is from any of these cities, so maybe these are ideas you can steal. Trenton has allocated about $5 million to a venture capital fund to incubate and support new businesses, which is really cool. Memphis is planning a community micro grocery initiative. Stockton is offering first-time home buyers down payment assistance. We saw a few other places doing this. And there are some basic income experiments happening in Alexandria. Actually, I think there's someone from Alexandria here, Sacramento, Minneapolis. And then it was really interesting to see Detroit is focusing explicitly on intergenerational poverty investments, all within housing, repairing, building affordable housing, offering down payment assistance. And I feel like this really speaks to the intersection of issues that you mentioned earlier, Councilmember Green, and the correlation between things that might not seem connected to poverty. I'll pause there just to say that in my previous life, we created an index called the Opportunity Index that you might have seen before. It is in another home, and I think it's being updated, but I think it's still worth looking and seeing where the intersectional issues are in your community. You can look by zip code. You can see things like the violent crime rate in relation to poverty and a number of different factors. And it really does give you some insight into like the specific areas that you can work that can also impact poverty in people. And then I also wanted to spotlight Phoenix. They're doing some really interesting things around food insecurity. They used some of the early tranche of funds to combat COVID relief, to combat COVID around food insecurity, but it was so successful that they've actually allocated some of their ARPA funds to continue some of this work. And I think it's a cool example of like an experiment based out of need that has had a proof point and is now being built on. So I'm going to share a little bit about that. They're funding this resilient food system that has developed, new collaborations and pipelines that will continue long beyond this experience. But they're offering agri-food technology grants that will provide funding and incentives to encourage food system entrepreneurs and innovative food businesses to expand or locate to Phoenix. They are starting an urban agriculture fellowship, which will provide one-year fellowships for high school and college-age students with an explicit commitment to bring in at least 60% students of color into this. They're piloting they're piloting a backyard food production program for 100 residents, giving them supplies to start gardens, essentially urban gardens. They're also working with nonprofits and land trusts to assist in the purchase and preservation of up to 100 acres of land for agriculture. And finally, they're starting resilient and sustainable agriculture projects by providing grants to farmers who are working on advanced technology that will address growing food in this changing climate that we're in. I just thought it was a really interesting approach. It's gotten the whole community involved, and there's sort of something for everybody and not sort of the usual spaces you might think about when you think about food insecurity, along with just getting food to their constituents. And the last point I'll make is sort of what cities are doing. Few are, I found, explicitly focused on communities of color. And so obviously, like, equity, we think of equity to be the setting of our work, but I think it's very valuable to explicitly state that as you're going out into your community. So 3 are doing something like that in the 20 we looked at. Syracuse will invest in minority business one-stop centers. Portland's going to invest in minority chambers of commerce. And then Phoenix, again, has an explicit equity and inclusion plan for its resilient food system. I think I'm probably getting close on time. So the last thought I wanted to offer for discussion is really preparing for this infrastructure bill. There's so much that obviously needs to happen, but really thinking about the projects that are funded versus the ones that are increasing funding versus the ones that require regulations and rules to be written, what can you deploy right away? Analyzing your workforce and making sure you have the right people to take on these jobs that are coming, and really thinking about equity again, that most of these jobs are traditionally jobs for men. And the women are kind of getting left out in the second Build Back Better bill. And so just having an explicit focus on who is going to benefit and making sure your workforce is prepared. And then really strengthening your public and private partnerships. This is going to take work with, I think nonprofits are often, as having run one, like really underestimated in the work they can do, but having those relationships in advance will help you reach the communities that are really going to need this. I'm going to stop there and hand it back to Councilmember Green.
Thank you. Thank you both, Amy and Monique, for your comments. If you don't mind, I'm going to stand. My mother was a teacher for about 31 years, so I call myself a TK, or teacher's kid. And when I was in law school, I had a chance to teach part-time at her school. So it was odd to hear students say, Mrs. Green, your son is Mr. Green? That's a separate story. I want to just ask a quick question. Have we succeeded in the war on poverty? Show of hands. No. Big no. I asked that question because and I'm going to talk about the public bank initiative that we're doing in Philadelphia. A friend of mine said, Derek, I think you are a radical capitalist. And I say that, and I think he said that because I focus on how we can address the war on poverty. And we've talked about a lot of policies from the public sector, the federal, state, and local level. But we all know as elected officials, we have a very finite amount of resources that come from taxes or sometimes federal state grants. We don't have enough money to provide all the resources to all the constituents that really need to be lifted out of poverty. So from my perspective, I often think of how can we have a public-private partnership and leverage opportunities to help more people to grow wealth. I know we are a group of Democrats from different perspectives, and some of our friends in the Democratic Party really don't look at the word of wealth as a positive way. Often you think of when you're talking about business or growing business, trying to grow wealth, oh, you're talking about, dare I say, The Apprentice and what that entails. I used to love the OJs, a certain song, but every time I hear that song from the OJs, I think of a certain person that's no longer in office. But wealth is not, and I don't want to go into the whole Gordon Gekko wealth is good perspective, but we need to find ways to help businesses, especially business of color, people that come from poor backgrounds from Appalachia or North Philadelphia or parts of Columbus or St. Louis, how can they grow wealth in their communities? And how can they grow wealth from a perspective of entrepreneurship? And there's been a lot of different ways of addressing poverty. One of the areas I've tried to really focus on is how do we grow businesses in cities and towns and jurisdictions all around our nation. Because if you're able to have that business grow, and if you think about a main street in your community, if that business owner, if she has 1 or 2 employees and able to go to 5 to 6 employees by growing that business, what type of impact will that have in that community? Those new employees are now able to spend dollars on that commercial card in that community. They may be able to invest more into their home, which improves their property value, which provides more dollars for the school district, which helps other business owners in that community because more dollars are circulating in that community. And also impacts the public safety issues we talked about and healthcare. So I've often tried to focus on how do we grow businesses in communities. And that comes from a background having worked as a small business lender at a regional bank in Philadelphia called Meridian Bank, and I actually had a little hair at that time. And we started seeing the issue of the historical issues of redlining. And this is before credit scores. I had my own lending authority, and I was able to give loans to people based on my knowledge and perspective on their ability to pay back a loan and help them grow, and giving loans based on what I knew from my analysis as a lender and trying to help them to grow. And then I left banking because credit scoring started to come in, and went to law school and went through the law school route. And then when I was in the city law department, my former boss started to see the issue of some of her members from her church who their husband had passed away or other dynamics started to get underwater on loans. And she really couldn't define what it was, but it was kind of the beginning of predatory lending. And so we worked on one of the nation's first anti-predatory lending bills, which became a model for a number of cities. And we all saw what happened to predatory lending and what happened to the recession. So then when I got elected into city council, I really tried to think, well, how do we address some of these issues of helping businesses to grow? And from my experience as a small business lender in North Philadelphia, and my other experiences as being an entrepreneur myself, being an attorney representing businesses, one of the issues that was always consistent was access to credit. Access to credit. And when we talk about this whole infrastructure bill, you're going to have constituents in your communities who are business owners, especially business owners of color, and they'll say, the Build Back Better or even the infrastructure plan, that's a great $1.2 trillion, but I don't have the ability to really access that opportunity because I only have a line of credit that goes so far. I don't have the cash flow to hire people to really even take advantage of these opportunities. And we see this cycle happen over and over and over again, and we see that war on poverty still not being addressed. So from those experiences, that's when I started to research this whole idea of a public bank. Because those constituents who are constituents who pay taxes, business taxes, and personal taxes, those tax dollars come into our cities and our states. So how can we leverage those dollars to make it easier for them to get access to credit? So I learned about the Bank of North Dakota, which started a public bank during the Depression, but there had not been any local-based or municipal-based public bank. And so I initially had hearings in City Council. We were able to bring in a consultant, HRNA, who's also worked with some other cities around the nation who are looking at this idea of public banking. From there, we were able to then hire outside counsel that we've been working with, along with our own law department and the finance department and treasurer's office, to come up with this model. And so we're now in the process of fine-tuning that legislation. But the goal of the public bank for what we're doing in the city of Philadelphia, and each jurisdiction may be a little different, but what we're trying to do is provide credit enhancement for small businesses in our city. So that way, if you are a business owner, and say you have a relationship with our community development financial institution, and they've given you a loan for $250,000, and you may have a deposit relation with a larger institution like a Wells Fargo. Well, now you've heard about the infrastructure plan, and you now want to take advantage of some of the opportunities from the public sector or even the private sector coming out of all of the challenges with George Floyd and businesses now trying to invest in Black and brown companies. But that loan of $250,000 you've had doesn't give you the ability to really participate because you need to have more access and more dollars available. And then the bank you've had a deposit relationship, like a Wells Fargo, you haven't had that lending relationship with them for a long period of time. So you need a $500,000 loan. The CDFI only goes up to $250,000, you're at that max. You don't have that relationship at that large institution like a Wells Fargo and others where you have a deposit relationship. So from the public bank concept, our thought is let's use some of the resources from the city of Philadelphia to provide a credit enhancement for that business owner. So now that when they go to a Wells Fargo or they go to a Bank of America or another institution, they have that collateral that can reduce that risk profile. Because as a banker, I understand, like, if I give you a loan, my concern is that going to be a delinquency. I've not had that deposit, that lending relationship with you, so I'm not sure if you will be able to handle a $500,000 loan, although you've had one for $250,000. And that $250,000 loan was at the CDFI, but not at my institution. So using the city as a way to provide that type of credit enhancement can make that business owner more attractive to a large institution. And so by making it more attractive, to me, will provide opportunities for them to be able to get that higher loan amount and also provide the opportunities for them to hire more people and take advantage of some of the things we're hearing about from the infrastructure bill and some of the capital projects that a lot of our cities are doing. And from my perspective, and there are a lot of different ways to try to address poverty, but it's trying to grow entrepreneurship and trying to create that wealth in our communities so they can hire more people in their neighborhoods, in their communities, which ultimately will provide more dollars to our city, into our general fund, and maybe at some point allow us to reduce our taxes because we've grown a larger base of successful businesses in our neighborhoods, in our communities, and it ultimately will help us move our cities forward so we can reduce some of the issues like gun violence and health care and other issues. So I'll close with that because I really want to have an opportunity for us to have a conversation and discussion because I know often when we come to these conferences, we only have like 5 minutes for Q&A. So I want to make sure we have a little more conversation and really learn from each other on different ideas because one of the benefits of going to a lot of these conferences is the relationships you develop and hearing the ideas from other cities and other towns so you can follow up on those ideas and bring them back to your own jurisdiction. So I'll close with that. Now I can either pass around the mic or we can all use our church voice or synagogue voice in reference to asking questions. So anyone want to raise a question? Don't make me be the teacher and have to call on people. Yes, Mayor Jones.
talking similar language that we talk in Wichita when it comes to entrepreneurship and investing in people, which creates opportunity for them to really gain wealth and gain opportunity. We have a microloan program now that we were able, I think we used, I'm not sure which funding pool we used for it, but it's targeted in one of our city council districts that happens to be our most red line district, or a district that is it's a traditional African American district. Oh, thank you. Yeah, and there's like it's like a jet engine over here, like. Well, in Wichita, we're the air capital of the world, so I'm always touring, like where they're building planes and stuff. So in the back of my mind, I'm thinking that there's like a Learjet, like getting fired up. Anyways, so in Wichita, we have a microloan type program. It's targeted to a particular district that is our traditional African American district. It is a district that also sadly is high in poverty. And looking at the data, we actually got requests from multiple areas throughout the city for this money, and talking to our economic development team, they kind of shrug off, like, we're never going to chase this money. But if it's successful, then it goes back into the pool and we can keep utilizing it, kind of like the public bank. What I'm wondering, because what's going to happen, we took over the council this last election. I'm going to make that citywide. It particularly is for people of color and women owned businesses is what we're gunning for. What other tools should we be looking at? So I know that the microloan type programs are not popular, but well known. What else should we be looking at, or what's a good resource of what's working when it comes to providing opportunity for entrepreneurship, particularly in communities that have been historically disadvantaged?
Well, I'm not sure if you have a strong CDFI network, or from a state level, or looking at other jurisdictions, because we've worked very closely with CDFIs or community development financial institutions in order to provide that opportunity. But another idea that I started in my first term, we created what's called the Philadelphia Business Lending Network. It's an entity, and it provides kind of a opportunity where we, as a Commerce Department, brought together various lenders, credit unions, other CDFIs, other non-traditional lenders, brought them together as a group and said, can you agree to a kind of a one-page information sheet? Because for a lot of small business owner, she is the most proficient person in their business, but also is an environmental technician, is an HR manager, is a marketing person, is a bookkeeper. And so going to multiple institutions to apply for a loan is a lot. So we were able to get these various entities to come together and say, we'll agree to a one-page kind of information sheet. And you can apply to the Business Lending Network through the Commerce Department, and when you apply to that application is online, it's then sent out to all the 34 different institutions within the Business Lending Network, and they'll review that information, and they'll say, hey, it's like a lending tree for small businesses. We're interested in providing you a loan, and then they'll connect directly to that business owner. So it may be 3 or 4 different lenders who will then connect with that business owner and say, we're interested in providing a loan, and then you go through the more formal process with that financial institution. But at least it gives the business owner an opportunity to do a one-stop shop and not have to go to different institutions. And with some of the lenders, they've told me that we have done loans to businesses that we never would have met but through the Business Lending Network. Also, it brings them together on a quarterly basis, and it kind of brought me back to my time when I was a lender, where we had loan committee, where we talk about different loans and perspectives. So you got a chance to see, well, FNATA, which is a CDFI in our strong Latin part of our community, of our city, versus a West Philadelphia Financial Service Institution, versus some of our smaller banks. They get to hear the type of loans and applications and trends that other banks are working on. So that's something that you can do within your city, or maybe through a statewide perspective, where you get various banks to kind of, and credit unions to agree to a kind of one-page information sheet, and then people can just apply through that, and then have the public sector, either your Commerce Department or maybe at the state level, send that information out to the various institutions that agree to it. And it's kind of like a public-private partnership.
I would just add one thing that's not quite in the straight up entrepreneurial space, but one of the other major employers in a lot of disadvantaged communities are nonprofits, the direct service agencies, where there's a lot of grants that become available, but they're not grants, they're contracts, and they're reimbursable. And so the community-based organizations don't actually have enough cash or to upfront the cost of them. And they're not the folks who are sitting there thinking, I think I'll go get a line of credit, because they're just trying to get a few more dollars to the people they're serving. So as you are thinking about opening up lending through a public bank or through microlending, really reach out to the community-based organizations as well and include them and educate them on the easy ways to access capital to help them make more of a change in their communities, because they often aren't thinking like that. And I think it's to the great detriment of the entire nonprofit ecosphere, especially the direct services.
I'll be the talk show host and bring the mic.
Where was that and what is that? Where was it? Gotcha. Yes.
I wanted to shift the conversation, if it's okay, to housing. In Vermont, I think a lot of people look at Vermont and think like Burlington, Stowe, and does poverty really exist? Yes, we have extreme rural poverty. 15% of Vermonters in the Northeast Kingdom live in poverty. But what we've seen during the pandemic is a large influx of people moving to the state and a real stress on the housing market. We very quickly at the beginning of the pandemic opened up all of our hotels and motels and used the FEMA reimbursement to provide direct payments to hotels and motels to house and support housing insecure Vermonters. And our governor, Republican, is now sort of at the place where he's like, we're going to give everyone in a hotel motel $2,500, say, good luck, here you go. And so my question is really around, and now we're with the extension, we'll continue the program through April, but we're not out of the pandemic, obviously, and there's no place to go. There's no home, there's no landlord, there's no rental property. But it's even assuming that the housing pieces could be addressed in terms of access, like that there was actual housing. My question is really around how to work with different stakeholders, like landlords, to incentivize, to educate, to be it in transitional housing for those coming out of correctional facilities, or for individuals who now have $2,500 but no place to go. And of course, every landlord is saying, well, we're not going to house you because you don't have a history of renting. So just sort of any thoughts, questions, ideas, because we definitely need them. More that question, ideas on how to bring, yeah.
The Los Angeles Homeless Services Authority, and I actually got reassigned during COVID to Project Ripley. It's a largest continuum, homeless housing continuum in the country, and they have faced some of the same challenges. And because building costs everywhere, right, have gone up, and they're only harder at the moment. And one of the things that they really do is like we found that a lot of the, especially motel owners who were open to being part of Project Rookie, were really looking for a buyout. And you can use ARPA funds for those buyouts.
What do you mean by that?
So
What do you mean?
Literally the city would buy
the
county,
hotel.
or sometimes the city, depending on what part of the county it was in, but bought the hotel and turned it into transitional housing. And there's just a lot of folks in that business, in that area of hospitality, who are older and retiring, and that, the trends in hospitality for rentals are shifting, and so they're not seeing as much as they used to, despite Schitt's Creek's appeal. And so, that was one of the solutions that we found, because there was just so many people. I think at one point we had close to 15,000 people
So that has happened? Yeah. And when did it happen, just out of curiosity?
They started them in, what year are we? So end of 19, they started doing the first fives, and they have folks who've been living in them for about 6 to 8 months at this point. Prioritizing families mostly.
And run by nonprofits, or this?
The nonprofits do the wraparound service, so landlords have bid come to the county and the city.
Wow.
We do that in Oregon too.
Okay.
Just that we do similar, and I can't speak intelligently to it to the level that you can because you work in this space. But as mayor, I get updated from our housing person. If we bought a hotel, but we pretty much handed the complete management over to our homeless, our nonprofit that works in the space of folks who are experiencing homelessness. So we don't manage any of it, and that's kind of the more conservative mindset that Wichita and Kansas takes. So there's probably a different model. So if you're testing the waters and there's an appetite to actually partner with maybe some of these folks who to manage, and there might be a carrot there where, well, if you're managing this property with these folks, maybe you can also be open to housing these other folks in your other property. There might be some magic that can happen there. But feel free to reach out to
Yeah, absolutely. We need
model.
answers, so that's, I will follow up with both of you. Thank you.
And so from the business community standpoint, probably not interested in doing or participating in that.
Right now, I think if you're a landlord in Vermont, you're like, I'm going to rent to the highest bidder with a perfect rental record, and there's no restrictions. I mean, it's.
So maybe even having, I'm not sure you're in the Chamber of Commerce on that, Chief, because yes, that may be the case for some, but I'm sure there's some other property owners, because of the pandemic, were really impacted by not having the regular type of tourists and other customers that they had in the past. So I think there's probably diversity of people. Some who are saying, well, I'm only going to rent to a certain profile, and they're probably doing better than others who may say, listen, I started this business and this business was going great, and all of a sudden the pandemic hit and no one anticipated that, and now I'm really behind financially.
Yeah.
And having this opportunity from even a temporary perspective can help them get out of this perspective. So it provides that kind of public-private partnership of helping those in the private sector who need some income, and they can do that by helping some who have been now homeless or transitory need a place to stay. And maybe do a short-term lease or a longer-term lease, but I think there's some opportunities to bring both sides together.
And I'll add one thing, is that one of the things that I found interesting when I started working in the anti-poverty space is people said, oh, you're working in healthcare? And I was like, no. And they would say, oh, you're working on homeless issue? No. But one of the intersections between the earned income tax credit and housing is that as I was working with housing groups, they say, look, the folks that who come to our transitional housing, we help them, they get it together, they get jobs, they can afford a monthly rent. What is hard for them to put together is the first and last and security deposit.
Yeah.
And that's where the earned income tax credit can come in because it's one lump sum. And I will say this year, this coming tax year, I don't know what's going to happen with the Build Back Better, but I know that some of the key provisions are only existing for this year. And that is the massive expansion of the EITC, where an individual without kids is going to get up to $1,500 back. If they have children, there will be more. So you can get a fairly significant lump sum that helps you establish yourself for that first month to get you in.
Yeah. $2,500 is not first and last month's rent. If it's and security deposit. It's just for a one-bedroom.
Right, no, we're in California, but so like there's a lot of ways to get more money. Like if you haven't filed and claimed it, you can claim it for the last 3 years.
Yeah.
4 years right now. And it also, if you haven't, people are using the tax, the government is usually using the tax system as a delivery, right, of the economic impact payments or stimulus payments. So once if you get people who haven't filed their taxes to file and claim these credits, there's actually a lot of different sources of income that will automatically start coming to them. And it will start getting into the thousands of dollars.
And you can help on that side too.
Okay.
Folks who are doing fine in your areas, we can partner to do a program.
Thank you.
We talked a lot about kind of moving in this next step of poverty. What we've been thinking about in our city a lot is generational wealth and home ownership. My husband and I purchased our first home through the Montgomery GI Bill. We were very lucky. My husband was homeless in high school, and our first house purchase was a big deal for him. And when he hit 20 years of not being homeless, we really reflected on what was the shift that happened in our life. And it was purchasing our first home that allowed us to purchase our next home. And in Oregon, we have a state VA program separate from the federal program that's 2% interest and no insurance required for the loan. That gives you massive purchasing power that doesn't exist anywhere else. And I feel as we're talking about Build Back Better and all these things, we've like eclipsed this opportunity that put a lot of people into middle class in this country. And it left a lot of people out. So I'm not saying it's a perfect program by any means. But is anyone doing work on that? Like if we're able to back bonds for veterans to purchase homes, is anyone talking about doing that for other groups of marginalized or traditionally not at the table? Because I think we can do all this work about taking the first step out of poverty, but we're not solving generational wealth by getting people to $2,500. We're extending how long they're out, and we're hoping they get a good job in all of those things. So I didn't know if anyone's working on that.
I was going to add an interesting point. There's new research that shows that now a house is not what keeps you out of generational poverty. You can backslide for the next generation.
Of course.
It's owning a second property. I'm from LA. I was like, what? I was like, I don't understand how you expect me to be able to come up for two houses, $2 million worth of capital, like to work with. Like, that's just not realistic. So I don't have an answer. I was just like, sometimes I want to say, what can we do that's outside of housing, because the housing stock is so limited that builds generational wealth, and I haven't seen a good answer. And I'd be excited if people have things that they see that are super innovative, because we're just not going to build up fast enough to be able to get everybody into one. So what are the other tools? We've been thinking about getting people invested, and there's baby bonds, but you were saying, oh no, it's just an idea. So I those are family, and I bought a house this time too. Like children have gone to the house and all that stuff. So I think you have curious studies. Now I'm a little nervous, like, because it has been, not just vulnerable, but it has been a common job here. It's not a house, it's the neighborhood. So this is just an idea. There are also, I think, things like work before. I know that's always on the chopping block, and I have feelings about that too. But an idea could be that it could be for benefit.
Right. Yeah. Yeah.
Like my sense, having spent a lot of time in those
Right.
as you know, is that the public feels like veterans burn that.
Right.
They work for it.
Right.
Putting that aside, you could make a case
Right.
for some sort of national service as one of the people on the college solution, even especially if you look at the thing around having a health score and the absolute realistic, maybe we could try to benefit to that around housing purchases. It's just an idea of doing it, but I think we have to find creative ways to move outward and leverage things that are happening with other ideas that are not happening.
I'm a big fan of compulsory service, military or otherwise. We know, like, I think giving back is a big deal, and I do feel like I earned my benefit. I'm a war veteran. I do feel like I earned my college benefit. It wasn't bestowed upon me to not have college debt. I served 14 months in a hell zone for it. But that's not the only way. Yeah, I do think that's an interesting idea.
One last thing that we're about to wrap up is also we need to think about this policy that can help retain wealth. And people forget that people are losing a lot of their homes through sheriff sales and foreclosures. And so things simply like making sure the family has a will.
Yeah.
As an attorney, Bill October, I work for my church, and helping people to have a will, because someone will say, well, I don't have a whole lot. Why do I need a will? It's like, well, you own a house. If you were to pass away and a husband or partner ex-husband passed away, who's going to get that property? And what often happens is you have one child that lives still in the city, another child that's outside the city, and another relative that lives a couple counties over, and they can't decide what the process is in reference to that property. I think of my own family, and then my grandfather on my father's side never got a chance to meet. We bought our family farm in 1943 outside of Greenville, North Carolina, that we still continue to operate to this day. We grew tobacco, and then we stopped growing tobacco. Like a story about for all of the family interests between the two of us, and we're going to do a deed for the farm. There's other parcels on the property that individual families in the past, but for the farm itself, us two are going to manage the farm. Now we're going through the process of being transferred to me and my wife. But you see the same thing in a lot of households where you don't have that type of foresight of saying, listen, we need to prepare with the will. And that's how you lose wealth. With the history of this country, I think about African American farmers and wealth from the South and where that has gone to this day. And it happens in cities and towns, in rural areas, in urban areas, suburban areas, all around this nation. So those are some other things that can be anti-poverty initiatives, just helping people to hold on to the assets that they have, so the next generation can use it and then use it for, starting a business, sending someone to college, or other opportunities. It's not Sunday, but thank you for closing out the closing ceremony. Thank you all.
And I'm just turning them on now. Did we choose the Q&A? Yeah, ready.
If I could get everybody to take their seats, we're going to get started with some brief remarks from Congressman Adam Schiff. It's 11:30 right now. Okay. So if everybody could just make their way to the tables, and we'll get started in just a moment, like 1 or 2. The Diane one? We told her to be ready at 11:40. Okay. I think she's on now.
Okay. So
I knew she wanted more time.
No, that's great. Okay. I just was realizing that we really cut it. Okay.
Yeah.
So.
But I mean, because we knew this was going to
Yeah. Yeah. So I think let's give it a minute to. After everyone starts. I was thinking I had my when I said that she was supposed to be on 11:30.
She called in at 11:30.
Yeah.
Right. You want to give another?
Maybe just let this group. Yeah.
I sent Alyssa down to light a fire because
also to please come to the virtual speaker. Please come to the front.
And one more note, we do have one of our keynotes as a virtual speaker, so please sit in the front. That way she'll be able to see you and engage with you both here and in her own home.
the leaders that went to, I don't remember who's dropping the roadmap around that. No, but I can ask them. Yeah. Okay. I was just trying to figure it out. Yeah. There was just a text that said his group should be coming out. Yeah, James arrested Jonathan Street about 30.
We got ours up. All right, please, everyone take your seats, and please do fill in at the front so our virtual keynote speaker will be able to see you. We appreciate that, and we will get started right now with some recorded remarks from Congressman Schiff.
Hello, I'm Congressman Adam Schiff, and thank you for the invitation to address the New Deal leaders at this year's conference. I know the incredible leadership that the conference has produced over the years is just extraordinary, and I'm flattered to be asked. I was requested to share a few thoughts on the state of our democracy, lessons learned from the impeachment, as well as a couple insights from the book that I just finished, Midnight in Washington, and I'm happy to do so. First, as to the state of our democracy, I think we are at a very fragile point in our nation's history. Most concerning to me are these efforts around the country to strip independent elections officials of their duties and give them over to partisan legislatures and partisan acolytes of the former president. This to me is an effort to, after having failed to secure, for example, 11,780 votes from the Secretary of State in Georgia that don't exist, the president, the former president, and his acolytes seem determined next year or in the next presidential election to find someone who will stuff the ballot box in that way. That is a real and present danger to our democracy. Coupled with these efforts to disenfranchise particularly people of color, and you have, I think, one of the most pressing threats that we have faced in generations. In terms of what we learned from the impeachment, I would just say this, that there's no flaw in the Constitution. There's no problem with its draftsmanship, no clause that needs revision, at least insofar as the impeachment power is concerned. I don't suggest, for example, that we reduce impeachment to a majority vote and turn the Congress into a parliament. But what we have discovered is if the members of Congress don't give meaning to their oath of office, if they don't allow their decision-making to be informed by ideas of right and wrong, if they're unwilling to acknowledge the plain truth, then none of it works. And this indeed was part of the reason I wrote the book, which was to explain how it was that so many people that I worked with and admired and respected across the aisle in the Congress, because I believed that they believed what they were saying, turned out not to believe it at all. Or if they did, none of it mattered as much as their own ambition, their position, or future hope of position. And this to me is what has us on such a fragile edge. But I will say this about the future. We're going to get through this. I titled the book Midnight in Washington because midnight may be the darkest hour of every day everywhere in the world, but it's also a time of great hopefulness because everything that follows is light. And I know that some of the light comes from the leadership that are gathered at the conference and what enormous contributions you've already made and others will make in the future. And I console myself in the knowledge that there are millions and millions more Americans who love and cherish our democracy than those who are trying to tear it down right now. So we will get through this, and we'll get through this with your help and leadership. So thank you for inviting me to say a few words. All my very best to the organizers and attendees, and here's to a successful conference. Thank you.
All right, thanks everybody. Thank you to Congressman Schiff, who really wanted to be here and was so gracious to send that in for us. Zeb Smathers here by chance? Can I say this from last night? We had Zeb had a great line last night about the difference between people who watch West Wing and watch House of Cards. And I wanted to know, I'm going to do it. So raise your hand if you are a West Winger. And raise your hand if you're a House of Cards person. Interesting. All right, well, Zeb's theory, and I thought it was, so that's a little more close to what I thought. Zeb's theory was that New Deal leaders were West Wingers, because of the better angels it speaks to, because of the feeling of possibility that we can get stuff done. So as we close out this conference, I thought it was really important that, we spent a lot of time talking about great, important policy work. We just ended with a conversation about the state of our democracy. And again, Congressman Schiff was so great to send that in. And we're going to hear from two great people who know a lot about this. I know that we think a lot about the divisions and the partisanship and we worry about whether we can ever come together as Americans. And so we're going to start today with a woman who's calling in virtually, and we're so grateful for her doing this, Diane Hessen. She's an award-winning entrepreneur, an innovator in market research, and an expert on the American voter. Her work in talking with American voters culminated in a book this summer called, I'm going to put my glasses on and make sure I get it right, called Our Common Ground, Insights from 4 Years of Listening to American Voters. And I've had the chance to speak to Diane briefly about this, and it's just fascinating what she's learned about the things that pull us together. And so I'm so grateful that she would spend some time with us here today. And I'll go ahead and introduce Ryan too at the same time. After Diane, we're going to hear from Ryan Enos, who's a political scientist at Harvard. He's the director of the Center for American Political Studies. In 2017, he wrote a book called The Space Between Us. And Ryan came to our attention because of some work he's done recently that was written up in the New York Times about the political bubbles that we live in across the country. So I want to thank both Diane and Ryan for being here, and I will turn it over to Diane.
Thank you. Hi, everyone. I am delighted to be with this incredible group, and I'm so sorry that I'm on a book tour and not able to be with you in person. If I were there, I would ask you to raise your hand if you feel that our country is incredibly and inextricably divided, and my guess is that most of you would be raising both hands. I'm going to take about 15 minutes or so to tell you what I've learned from a massive research project that I've been engaged in since 2006 to understand the American electorate, and hopefully it will help you understand why I actually have great hope, just like Adam Schiff did. I've spent most of the last 2 decades in the market research space as CEO of a company called Communispace that was the first to really leverage technology and social media to help brands understand consumers. And to make a long story short, I dove into political research when a friend from the Clinton campaign asked me to help them try something a little different from the standard fare, a little different from polls and focus groups. And I left my business career in 2016 to jump into the fray and eventually set up a project where I was in conversation every week with a group of 500 voters, and the conversation went on for 4.5 years. These 500 people were from all points along the political spectrum, every age, every state, every ethnicity, and this amazing group helped me to understand their lives, their dreams, and their perspectives on our country and our world. I learned everything from why people are unhappy with their political parties, to why 35 million Americans think the 2020 election was fraudulent, to why a woman would ever vote for Donald Trump, to why millennials have not been interested in voting, to why people are disengaged with foreign policy, to what was really happening at Trump rallies. And whenever I learned something new, I'd write an op-ed for the Boston Globe. And after 55 columns and 7 million pieces of data, it all culminated in Our Common Ground. Got it right here, ta-da, which was just published this summer. I have so much that I want to share with all of you, but let me just net out a few themes from what I've learned from the electorate and written about. So theme number 1, when it comes to policy, there is generally much, much more common ground than you would think in the United States. So if you ask voters about the issues, immigration, gun control, healthcare, infrastructure, and so on, you can get 80% of the electorate to be willing to compromise on a particular solution. So it doesn't mean total agreement, but they're okay enough to move ahead. So for instance, you can get 80% of our country to agree on an immigration bill that gives dreamers a path to citizenship, builds a physical wall in some parts of the southern border, increases humanitarian treatment for arriving migrants, adds more screening resources and tech at our borders, and so on. It might not be an ideal bill for everyone, but people would be fine with it. But these bills are not passing for at least two reasons. One is that many of our elected leaders are better off with no resolution. First, they worry about one line in the legislation being controversial and someone primarying them based on that particular feature of a bill. And even more, it's just easier to be a Republican and scream and yell that immigrants are pouring into our country and that if they elect you, you will stop them. Or to be a Democrat and make the case for compassion and say that you will make sure no child is ever again put in a cage and so on. The act of resolving the issue takes the talking points away. And so we perceive that we agree on nothing. Number two, because of that, we have perceptions, we all have perceptions of the other side that are really inaccurate. So for instance, if you ask most Republicans about the Democratic Party, they will say, Democrats are a bunch of elitist socialists who want to take my hard-earned tax dollars and give them away to criminals, illegal immigrants, and people who are too lazy to work. They want to take away guns, allow women to use abortions as birth control, and they want to completely dismantle policing. Or if you ask most Democrats about Republicans, and especially those who were Trump supporters, they will say they're a bunch of hypocritical, uneducated deplorables who sleep with their guns, refuse to wear masks, deny that climate change is happening, and never met a Black person they liked. Both of these are inaccurate, but these stereotypes were on the ballot in our country last November. They dominate what we hear from the media. The radicals the extremes are really getting the airtime, and thus they become ingrained into our perspectives. I will tell you, I had 500 voters in my panel. It was pretty representative. I'd say about a dozen of them were really pretty awful. The rest care about their families, don't have particularly crazy views of the world, and are just trying to get by. But they don't really have the voices that those on the extremes have. I will also tell you that at the moment, I would estimate that about 70% of Americans would describe themselves as moderates or as independents. And they use those terms independently. They think they are a small group because they don't get the airtime, and they certainly don't see a lot of moderates in Congress. These are voters who want to make progress, but who don't believe that government is the solution to every problem we have, and I'll come back to that. Third point is voting against versus voting for. So in 2016, the number one reason people told me they voted for Donald Trump was not that they thought he was a really great guy. They just hated Hillary Clinton. So many voters thought this is not, oh, she's opaque. There's a whole group of voters who believe that she was totally corrupt, and they would state this entire lifetime of questionable activities. That was hard for me to hear personally, but it was just Whitewater, Vince Foster, the Clinton Foundation, Benghazi, stealing furniture from the White House, Hillary defending her husband against women who accused him of sexual harassment and then saying she was a supporter of women. And the emails were just one more thing. So this dislike of the alternative is an enormously important dynamic. It also happened in 2020. Lots of people who voted for Biden were just voting against Trump, and lots of people who voted for Trump were just voting against Biden. People who voted for Trump in 2020 told me they thought Biden had dementia, that his claim that he is moderate would be hijacked by the radical liberals in the party and mess up any chance of an economic recovery. And they characterized him as too quiet and weak for our times. Biden supporters told me they thought Trump was a lying, cheating buffoon who panders to Putin and only cares about himself. And you see this all the time, this dislike of the alternative, even recently in Virginia, where the reason to vote against Glenn Youngkin was to vote against the man who said parents don't have a right to say what their children will learn. So, of course, we have not always voted against things. From time to time, there is a candidate who is so magnetic, so inspirational, like Obama was, particularly in 2008, that people vote for someone. But you hear a lot about people saying, I like this person, I don't agree with them, but at least it's not the other side. Point number 4, language matters. So in my first op-ed in November of 2016, it went viral because I wrote about how, according to my voters, the moment when most undecideds switched to Trump was when Hillary Clinton said that you could put half of his supporters into a basket of deplorables. And that word stuck even to this day. In 2020, despite Trump's low approval ratings, the election was much closer than people predicted, partially because of 2 words that Trump used again and again and again: radical socialism. Instead of understanding what people were afraid of, lots of Democrats responded to the radical socialism thing intellectually. Oh, these people don't even know what socialism is. But that was a bad idea because people believed they knew. And although Democrats said it's ridiculous and Biden said, do I look like a socialist? The answer from the right was the radicals are coming. And it worked, and it's still working. In fact, if you ask most Republicans right now what they think of Biden, they will be negative because they believe he is recommending and implementing socialist policies. Those are the negatives much more so than Afghanistan. It's the narrative that people have learned. And it's the reason why the current Build Back Better legislation that passed this morning could be incredible fodder for the Republicans for 2022. You can hear the messaging now. All of those trillions of dollars going to free, free, free. Radical socialism, a complete misuse of your precious tax dollars. And I think just mentioning Virginia, that vote, again, against one line about not giving parents a say in what their kids learn in school. This was brutal for Terry McAuliffe, just like the word deplorables was for Hillary Clinton, and the phrase from Mitt Romney that he was just not going to worry about 47% of the country. 5th, my last chapter is prescriptive, and it basically implores us to change the way we have conversations with each other. We have to listen to each other. So now, most of us, you hear an opinion that's different from yours. We tend to respond with a counter argument. You think there was voter fraud? Well, read this article, watch this video. Look at these statistics, 50 out of 51 cases were, thrown out by judges, et cetera. But those responses don't do much to change people's minds. So I have a lot of advice about how to do this, but in general, we must learn to say, tell me more. We have to learn to walk in each other's shoes. And when we do this, we always learn, and we create an environment in which the other side is way more inclined to listen to what we have to say. I want to save some time for questions, and so I'm only going to take another minute here, but you are all so important to the future of our cities and towns and states and our country. If any of you want to follow up after this, my email is exactly what you would bet it is. It's dhessen@gmail.com. I would be more than happy to write back to you. So let me leave you with this. Americans are tired and worried. And it's not just COVID. So you all know this. 78% of American full-time workers say they live paycheck to paycheck. 71% are in debt. Over half of those in debt say they are in over their heads. They save less than $100 each month. I cannot tell you the stories I've heard from people over the last 4.5 years about what is really going on in their lives. But for the people in this room, these citizens do want a better New Deal, kind of a new American dream. They want a promise that once again, if you live in the United States of America, the sky's the limit. You know, that upward mobility is wired into the way things work. But the specific deal that people want is this, that in exchange for the benefits of living in an extraordinary country, its citizens will work hard, participate in their communities, respect and honor diverse opinions, and not expect to be taken care of unconditionally by the government. You know, they want a government that makes heroes out of the people who give more than they take, the veterans, the first responders, our best teachers. They want leaders who will embrace innovation and who have new and exciting ideas about how to really help people that involve something other than sending them checks, where they can truly help themselves. And they want a government that gives them a voice. So let me stop there and just see what kinds of questions you have.
Thank you, and thank you. That was excellent.
There's the audience. Hi, everybody.
Hello. Oh, sure. I'm Dave Ehrenberg, a state attorney for Palm Beach County, and a new deal leader. So,
hey, Dave. I am right near you right now.
Where are you right now?
I'm in Palm Beach Gardens.
Oh my gosh, yes. My neck of the woods. I'm your state attorney there. I'll make sure you're safe while you're in town. So, you know, it's frustrating to me. It seems that the other side, the Republicans, are really good at the messaging. Whether it's Fox News, they just have this single message that plays, whereas we always try to, as you say, explain everything from our heads. We're going to explain away why we're not socialist by giving you policy points and immigration plans and all these things. What is the way to convince people? I guess it's through the heart, and that goes to the other question of how do you convince people that the election wasn't stolen? You say listen to them. I get that, but what are the kind of messages that Democrats need to win in 2022?
Yeah. Well, I do think that the biggest competitor in 2022 is what Americans think of as radical socialism. People are not excited about free. So for instance, if you pull apart the Build Back Better bill, you can say 82% of Americans are in favor of child care tax credits. 92% of Americans are in favor of this. I mean, you can go down the row of everything in that bill. The problem is that the big, massive combination of all of those issues is very scary to people. So while the individual policy issues people are for, the combination of everything with what they perceive to be outrageously high spending that we can't afford as a company is not popular. And I think it's an issue for us. There's a narrative in our country right now that if we just send a lot of money to people and we do what's in this Build Back Better law, that 2022 will be better for the Democrats. And actually, based on what I'm hearing from my voters, it's actually not the case. I think that it could backfire on us. So when I say listen, and many of you are in very, very senior levels locally in a particular state or city or county, I really think it's important to make sure that people feel heard. So David, one of your examples was voter fraud. It's amazing what you learn when you talk to someone who believes there was voter fraud and you really, really try to go deeply into what's happening for them. I mean, all of a sudden, you'll hear things like the number one issue who are most of the people who believe there was fraud talk about mail-in ballots and how they are subject, especially when you don't have to prove who you are to be able to send the ballot in. That's the dominant issue on fraud. So it's not I love Donald Trump, I wish he were president, therefore I thought there was fraud. There's actually significant, specific objections that people have, like mail-in ballots, like the fact that most people who are under the age of 35 don't understand why we're still taking a piece of paper and filling in little holes with a black magic marker to actually do our voting when we can't use technology, and I can kind of go through all the variations in what people think is fraudulent. But what you'll hear from people on the other side is, this is a huge issue for us. When there was a huge issue for the Democrats, like foreign interference in our elections, we got a commission. We spent $35 million. We had a big federal thing. We had witnesses, we had cases, we had analysis, we had a team. When we talk about voter fraud, no one does a bipartisan commission. No one spends any money. We just hear about some local judges that are throwing things out. So there's also this sense of, when I have an issue, no one really respects what it is. So I do think that's a lot of it, that people feel that very often, Democrats, or specifically their elected leaders, are just not paying attention to what's going on in their lives. And I think that's where it starts, is by listening. I'm not sure it's one word that will work for us.
My name is Hugh. I work for an organization called the Welcome Party that's trying to build a Big Tent Democratic Party full of people who disagree on a range of issues across the political spectrum. And not a New Deal leader, but very much a big fan of the New Deal. I'm curious, I think this builds on David's question. So much of I think the issues that you talked about where we disagree seem to come from talking points that people have heard in the media. How do you make sense of the role of media and how we address that in the points that you make?
I think right now, and this is not news to any of you, I will tell you that when I poll my voters, and the numbers haven't changed, 92% of my voters told me that they thought the media was biased. I mean, we already know that this is the model. So when I lay out all of this common ground, people are shocked until they start talking to each other and saying, oh, actually, that's pretty amazing. We do agree on that particular issue. I will say that people ask me a lot, is there something that I can read? Is there a place I can go? Why doesn't somebody come up with something? I pretty much believe that the days of media giving us, what people yearn for from the past, when we had 3 channels and common language and everything, are pretty much gone. I think that as a country, we're in phase 1 of this. We need to learn that what we're going to get from the media is a perspective, a set of opinions, and we're going to have to learn to just get much, much better at searching for truth in other ways. There will be companies that come out with technologies that allow us to see what's going on, but I think people are pretty skeptical of what they're hearing from the media. My voters are telling me that they're not really watching the news very much anymore, that they just can't take it. It's invest in Netflix, because people are watching Netflix and they're actually not watching CNN, MSNBC, or, Fox for that matter. I think people feel confused. I'm less worried about the media and more worried. I'll give you an example. People read crazy stories in the media and then they generalize. So there was a story about 2 days ago about an Arizona State University professor who is advocating for grades only being about effort and not anything about the quality of the response, because to judge a student on the quality of the response is racist. Now, this is a really extreme position, but what happens is people who are Republicans read this and they say, the Democrats are going crazy. I wouldn't vote for someone like that. And I think because of the radicalization of all of our messages, everybody thinks that the other side, is nuts. And I think we need to call out, we have to call this out. I always say to people, this is so important, and you all know this. I mean, we have huge issues as a country. You've been talking about this for the past 2 days. Climate change is staring us in the face. We do have problems at the border. We do have foreign actors trying to hack our electrical system. We do have bridges that are crumbling. I mean, I can go on and on with all of the issues that we have, certainly gun control. And when we hear these crazy stories, they're a distraction. When we hear, today Marjorie Taylor Greene said that there are pink aliens in the White House or whatever, we go there. It's like the Kardashians. That's what we're listening to instead of like focusing on the really, really important issues. But it's fear. And I think that's what we need to play to. I'll give you something that's a little bit more mainstream. This Christmas, I guess we canceled the song, Baby It's Cold Outside, which is an old time song. Lots of different famous singers have sung it, a song that suggested, sexual aggression. And yet, as we canceled that, the #1 song in the nation for over 2 months and a Grammy Award winner for Best Hip Hop Song was Wet Ass Pussy. I will tell you that there are videos all about how crazy our country is because we would cancel something that seemed benign on the surface and applaud something that seems so profane. Now, I will tell you, I had a 2-hour conversation with my daughters to understand this dynamic. But the point is that this issue is associated with Democrats. And Republicans believe that if you are a Democrat, you support all of this. It's not icing on the cake. This is fundamental to the perception of the party. So I think the other advice I would give is don't make the assumption that people know how to put this in perspective or how to put things in context. Every time you hear a crazy story, it layers in the reputation of a particular candidate, of a particular party. And I think we just need to make sure that we're calling out extreme situations as, do you know that that's not what the rest of us believe? Do you know that that is not the particular case? Because otherwise people are just throwing their hands up in the air. We have to call it out.
Engage you further along the line. Thank you for being with us. Thank you. Okay. Ryan, introduce yourself.
She couldn't hear you unless you speak the microphone.
Sorry, Dan, I'm told that you couldn't hear me because I wasn't speaking into the microphone. Thank you so much for being with us. And we very much hope we can engage you in the future. And thank you so much for making yourself available to the leaders. Thanks for making the time to call in.
Thank you,
This is Ryan
everyone.
Enos.
Thanks for all you do.
Hi, everyone. Thanks for having me. I'm Ryan Enos. I'm a professor at Harvard, and I study political psychology and political geography, among other things. I have some images to show you, and I think those slides are around somewhere. Is that true? Yeah, they're coming. I'll say, as those are coming up, I lecture to Harvard undergrads at least twice a week, and this is actually the first time in probably 2 years that I've talked to anybody without a mask on. So it's nice to be up here talking to all of you. Another thing I talk to Harvard undergrads a lot about is how we define what a social scientist is. And there's these phrases that people throw around about a hard science or a soft science. And the thing I always say to them is that social science is actually a really hard science, because the thing we study, people and institutions, are actually really, really complicated. And the tools we have to study them are really bad. Like, we can't take people and put them in a laboratory and do experiments on them, not very much anyway. And so we actually haven't learned much over the years. We've been doing modern social science for about 60 years, and we haven't actually figured many things out. But one of the things that we figured out with great certainty is that segregation is really bad for people, that it's really bad for groups. That when groups of people are segregated from each other, it causes things that are bad for society. It causes people to think poorly about other groups. It means that they don't trust people across groups. And it also means that they can't come together to cooperate with each other. And we understand this very well, that when groups are segregated in diverse societies, that they have trouble cooperating and solving the kind of dilemmas that we face in group societies or in diverse societies that only cooperation can solve. And so the thing I'm going to talk to you about today, actually, is something that speaks about the state of segregation between Republicans and Democrats in the United States. And it's going to draw on some of what you see in this map here, which is that we actually measured the location of every single voter in the United States in 2018 and saw how segregated they were from each other and started thinking about whether or not this is a problem. And what I'm going to show you is that the depth of segregation between Republicans and Democrats in the United States goes very, very deep. And we can think about the implications of that. So we're used to thinking about segregation between Republicans and Democrats, perhaps for something like this, where we look at states and think of them as red or blue. And we all know, especially since all of you are local leaders, that it goes much deeper than this. That, for example, if we break things down into counties, we could look at a red state like Texas and understand that there's blue counties even within Texas. Or even in Massachusetts, where I live now, they're a little hard to see on this map, but there are red places in Massachusetts, for example, and that there's a lot of diversity even within states. But what we find is even when we look within counties, so for example, this is the Los Angeles metro area, that we can find places where Republicans and Democrats are separated even there. And the experience of a voter, depending on where they live, even in a place like Los Angeles, is going to vary a lot depending on where they live. So down in the southwest corner of this map is what's known as the South Bay in Los Angeles, where communities like Hermosa Beach and Manhattan Beach, where I met my wife, are located. And a Democrat living there is actually going to meet a lot of Republicans in this very blue county. About half the people they would meet would be Republicans. But if you look in the center of that map, that very blue area in the Los Angeles basin, almost every person a Democrat would meet living there would be another Democrat. Nearly 100%. In their daily life, they would be not exposed to a Republican not once. And so the lived experience of having communication across different types of people that hold different views from you is going to be very different depending on where you live in this area. And we see this everywhere. This is Boston, where I live now. If you live in Cambridge, and if you stared at this map, even if you're not familiar with Boston, you would know where Cambridge is because it's the bluest of blue places. And if you live there, and I guarantee you this is true from my lived experience, you will not find a Republican anywhere. There's a few, but they're hiding, and they're hard to find. And yet, if you go to other parts of Boston, not far away, if you go down to the South Shore, even within Boston, into South Boston, for example, the old Southie neighborhood, Republicans are pretty common. You'll find them, and they're there, and you know who they are, and you'll see them. And so the lived experience of that contact across parties is very different. And we can see this everywhere. This is Atlanta. I'll show you a lot of pictures, so if I happen to find your place, we can talk about it later. This is Atlanta, and you can see this familiar pattern that all of you are familiar with. You don't need a political scientist up here telling you this, that we see this blue core of a city surrounded by these red places. But what I'm going to show you here, and this map gets a little fuzzy, so it's harder to see as I'm zooming in, what we found when we did this research is that even if you go down to neighborhoods, even if you go down to census tracts, which is the way we often think of as a neighborhood, you'll see that Republicans live closer to Republicans and Democrats live closer to Democrats. That even within individual neighborhoods, people tend to separate a little bit by party. And this is what we found really interesting, and in many ways found very concerning. And I'll show you some more pictures of this. Let me tell you first about how we thought about this and how we did this, and I'll just talk about it briefly, is we took every voter in the United States, it's about 180 million people, and we took each one of them, and we measured their distance to the 1,000 nearest people around them, and created these measures of what are called exposure, which is how likely you are to see a person from the other party in your daily life. And so if you have an exposure of 0, it means you're going to see 0 of the other party in your daily life. And if you have exposure of 100 or 1, you're going to see all people from the other party there. And so, for example, this picture that is on your left, I think, is a Republican in north of Milwaukee along the lakeshore there. And their exposure to Democrats is going to be really, really low because they're surrounded by other Republicans that are clustered near them on the lakeshore. The other person you see there is a Democrat in rural southeast Kansas. And that Democrat, even though they're in a highly Republican area, they're going to be even less likely to see Republicans than or Democrats than you might think, because the other Democrats live far away from them and are clustered into these small communities that Democrats tend to live in, even in a rural part of the country like Kansas. And so what this looks like if you see the whole country, and I'll show you some more maps like this afterwards, but what this looks like is we can see if we look at this graph on the top, which is a measure of exposure, and this is every voter in the country you see up there. And the blue people are Democrats and the red people are Republicans. And so keep in mind, people that are over there where it says 1, those are people where every person they would meet would be a person from the other party in their daily life. People at 0 are people that would never see somebody from the other party. And to just give you a sense of this, when we think of racial segregation, which is often how we think of segregation, the city of Chicago, for example, which is a famously segregated city by race, would be about a 0.3 on that chart, meaning that a white person in Chicago, about 30% of the people they would meet in their daily life would be African Americans. But your typical Democrat, I want you to look at where the peak of that graph is. A typical Democrat is about at 0.05 on this chart. So that is the modal Democrat in the United States. About 95% of the people they meet around their daily environment is going to be another Democrat. And so we see these shockingly high levels of segregation for the typical Democrat in the United States. Now we can break this down. I want you to keep in mind the typical is not necessarily the same thing as a mean. And the mean is over there around 0.3, which means that about 30% of the people they meet would be Republicans, 70% would be Democrats. But that's still a very high level of segregation. So what does this look like in practice? Well, here's Washington, D.C., where we all are now. You can think about what that looks like. A shockingly segregated place, in my opinion, is Milwaukee. This is one of the most stark examples of segregation we see, and you see this familiar pattern again. You see this in a lot of different places, another battleground state, like in Cincinnati, Ohio. So these are the places where our presidential elections are decided. And you see extremely high levels of segregation. It's not that people in battleground states are talking to each other across party lines, it's that they're sitting not talking to each other and voting the way they would and happen to be on balance about 50-50. You see this in red states. This is the Indianapolis area. You see it in the South. This is Birmingham. You see it all over the place, is basically what this map is showing you. So this is taking every voter in the United States and again putting them in major metropolitan areas, minor or outside a metropolitan area. A major metropolitan area is a place with more than 1 million people. So this would be, for example, Tucson would be the smallest one of these. And a minor area is one with less than 1 million people, so like Honolulu would be the largest of these. And these are divided up by dense to not dense census tracts. And the highest density census tracts are going to be the top quarter of dense census tracts in the United States. What I want you to notice about these is in all these places, even in minor metropolitan areas, even in rather low density places, you still see this peak of segregated Democrats. And in fact, Republicans don't start to look that way, where they are basically only surrounded by other Republicans, until you get to these really low density places outside of major metropolitan areas where most people don't live. Only about 8 million people in the whole United States live in places like that. And so really, a lot of voters and a lot of Democrats are experiencing this overwhelming segregation with other Democrats, and it's across a large proportion of places. The question I always get about this, and I'll show you a couple pictures on this and then I'll wrap up and I'll be happy to answer your questions, is why is this? Why are Democrats and Republicans so segregated from each other? And part of it is we actually don't know. You know, like I said, social science is hard. It's hard to know, we know where people live, it's hard to know why they live there for a lot of reasons. A big part of it though, of course, is race. It has to do with the racial imbalance in the party. This is Birmingham, Alabama, and you can see that on display here. So this is in the central part of Birmingham, and you can see that big divide with Democrats in the north and that area of Republicans on the south. That's racial segregation right there. Almost all those Republicans are white, almost all the Democrats you see in the north are black, and that's racial segregation. But that doesn't explain all of it. Here's another picture of Birmingham. This census tract is almost literally 100% white. There's like 6 non-white people in this whole census tract. And yet you'll see, and you can see this clustering of Democrats away from Republicans. Looking up at the northern part of this census tract, you'll see an overwhelming number of Republicans. So a big part of this is housing. This is where Republicans, and we all know this is reality, still in this country, Republicans are higher income than Democrats on average, and those Republicans are living in bigger houses in less dense areas. But even that doesn't explain all of it, and I'll go somewhere else. This is Los Angeles, the Los Angeles area, West Hollywood, and the Beverly Hills area. The homes over in the eastern part of this map in West Hollywood, the median home price there is approaching $2 million for a house. And yet we see a huge density of Democrats there, not poor Democrats, but Democrats that have divided from the Republicans that are further to the west from there. And part of what this probably reflects, and this is the part that's very interesting about it, part of what this, and can be problematic, part of what this probably reflects is that parties have come to coincide with choices in lifestyle in this country. And that often people are divided by things like lifestyle and cultural choices by parties in a way that drives them further apart. And we see it reflected in these housing patterns, even in blue counties like in Los Angeles. So I'll stop there and I'll say I'm happy to answer questions about any part of this and about where we think it's going in the future and what we think it does to the politics in our country. And I'm happy to talk to any of you about the maps or your own place. I've got maps of those as well. And thank you for your time today.
Hey there, I'm wondering, Lauren McLean from Boise, I'm wondering what if you take the last speaker's suggestion and answer that listening is key to getting us out of where we're at now, and
Yeah.
you overlay that listening challenge with these maps, what your response would be in terms of how to make that real.
How to make the listening actually happen since people are separated like that? Yeah, well, that's a good question. So I think part of it is, I don't want to, sometimes we can think of this residential segregation as a really sensationalistically bad thing, and that's why like the New York Times picked up on this research and things like that. Part of it is to realize there are spaces where people come together and they can listen to each other, right? So this is residences. And people still come together in workplaces, and they come together in schools, and they come together in places like that. And listening can happen in places like that, and we hope it does. The other thing we should say, and you can think of this as good or bad depending on what perspective you come from, but we see evidence that people do hear from the other party, and it changes the way they think about politics. So depending on how you think about politics, this may blow your mind, but we're pretty sure it's true, is, for example, a Democrat that is surrounded by Republicans for some reason in their daily life, they actually over time are somewhat likely to become a Republican. They will change their party affiliation. Same thing for a Republican that finds himself sort of surrounded by Democrats. They will change their party affiliation. So, sometimes in modern times we think of these parties as these immutable characteristics, almost like we think of as race, and that's actually how social scientists describe them. They think of them as a social identity, like race or religion. But that can overstate the case because generally those are not things that change, and things like like your party can. Doesn't change often, but it can. And part of that comes from listening. It's because you hear from the people, you hear from your neighbors, and it changes the way you think about people. There becomes a chicken and an egg problem where we need people actually to have those neighbors so they can hear from each other. But when it happens, there seems to be something to it. It's certainly true.
How do you map the decline to state voters, 25% of Californians?
Yeah, absolutely. So one thing we understand very well from social science is that most of the people that decline to state are not doing that because they're not actually partisans. So about 90% of people that claim to be independents, either when you ask them or when they register to vote, are people that vote about 90% of the same time with the same party. So about 90% of the people that say they're independents vote 90% of the time with the same party. So there's a very small fraction of people that are true independents. So what we do in this case is we go through a process of imputation where we look at their social characteristics and we look at where they live, and then we essentially make an educated guess at their party. And then we went out and we surveyed about 100,000 of these people, and it turned out that our educated guesses were very good, actually, as it turns out. So we're accurate about as much as we think we possibly could be given survey error. And then we map them as the party we guess at. And that's actually going to affect things, because it's a very good question, because it's going to affect the way we look at things. Because, for example, in some states, you can't register by a party. So we're actually just guessing for the whole state. But ultimately, we feel extremely good about those guesses because it turns out we're kind of right. And one thing I'll say about that is actually that shows a lot about this final point I made, though, about how social characteristics have come to define our party. Because what we're doing is we're looking at things like a person's age and their race and where they live and a few other characteristics about them, and we can make extremely accurate guesses about their party, which wasn't the case in the United States about 50 years ago.
Hi, Lee Harris, and I'm from Memphis.
Yeah.
And I wonder whether or not we're sure that political party preference actually corresponds with ideology. So again, I'm from Memphis, and we've got lots of black voters, which means lots of Democrats, but not necessarily lots of liberals.
Sure.
And so you may be exposed to a variety of perspectives, even though you're surrounded by Democrats.
Yeah, this is absolutely true. It doesn't coincide perfectly with it. It coincides better with it than it used to, which is an interesting thing. It used to be you had a lot of conservative Democrats, and those have become a rarer species than they used to be. It used to be you have liberal Republicans in places like New England, where I live now, but it's less true. But your point more largely is absolutely true. It's not a perfect measure for ideology, and so. One of the things that's interesting, of course, is to think about if you are a Democrat, and we're saying you're a Democrat, and on our mapping, but you live close to Republicans, it could be those Democrats tend to be more conservative, perhaps, than a Democrat that lives further away from Republicans. And those types of nuances are certainly worth thinking about when we look at this type of data. There's no doubt.
Thank you for this presentation.
Sure.
And as I was leaning towards Senator Haskell, I'm Kristen McCarthy-Vahey. I'm a state rep in Fairfield, and we did a zoning bill last year, a new group in Connecticut called Desegregate Connecticut.
Yeah.
And so I started rocking a little bit based on that experience. It was really difficult. And you started out by saying segregation is really bad for us. And then you were talking about the fact that even though these maps look the way that we do, we come together in workplaces, at schools, and I would also offer, community organizations and churches, which I'm sure, but workplaces are changing. We're not coming together the way we were physically. And last night had a great conversation with a fellow leader about the increasing politicization of, for example, the Catholic Church, and the way that people are segregating themselves that way. So will you be looking at that going forward in research, and in the face of that, what do you offer? Because certainly zoning policy is something we're going to continue to work on in our state, but I can guarantee there will be a continued tremendous resistance to that.
Yeah. Well, this is an excellent question, and so I get this question a lot about essentially what do we do about these things, and one of the answers I often give is, as a social scientist, my job is just to point out problems, not to say how to fix them. Those are what all of you do, but I do have a lot of thoughts on this, which I'll offer you, and one, of course, is about housing, and part of this phenomenon and why we think it's increased over time has been the sorting of parties by income, especially among white people in the United States, and as long as central cities become more and more expensive to live in, because we don't have enough housing, is dividing the parties along this urban-rural divide in a way when parties become associated with income. But that's not all of it. We often, when I show these pictures, we tend to think that this is a process of people moving somewhere. Like, you're a Democrat and you look around and you're like, I want to live next to other Democrats, so I'm going to move to Cambridge or to central Los Angeles or something like that. And that's not a lot of it. Most people don't move, and most people far from where they originally were born, actually. And most people don't move because of party. That's something out of their mind. They're moving for other reasons. They're moving for schools and things like that. But a lot of what we're seeing here is the parties changing around people, because it's becoming harder to be, for example, a working class white Republican or Democrat in this country. It's becoming harder to be a college-educated white Republican in this country. And so as the parties change around people, this process of people changing their parties to sort into places happens. And so what space is left over? And this is exactly your question. If these parties are socially sorting around you, where do you meet people that are different from you and exchange ideas? And a big part of what I originally researched, and actually most of my research is not on this, it's on things like racial and ethnic segregation in the United States and other places, was thinking about how segregation is solved in public spaces, in places like parks, in places like public transit, actually, where people have to come together in a lot of places and see people that are different than them. And there's actually evidence, and I've got some of this myself, that even being around people for fleeting moments that are different than you changes the way you think about them in a positive way. Being on public transportation with somebody and they're different than you changes the way you think about that group. Getting in a taxi with somebody or an Uber or whatever than somebody that's different from you changes the way you think about that driver. And I think one of the ways we can think about this for people who are interested in public policy is ask, what can we do to create those spaces? What can we do to say we invest in places that are well-run, places outside of the home where people can go and be around people that are different from them? Because there actually is some evidence that Republicans and Democrats have different preferences for parks, but it's not a very big difference. Everybody likes to be outside in the sunshine if it's a nice place to be. And so building that kind of stuff, building places where people come together in public spaces really is a key to a lot of not just political divides, but other types of divides we have in this country.
More of a comment than a question. I'm from North Carolina, and we've dealt with a lot of gerrymandering since 2010. And I want to commend you on the beautiful presentation and incredible graphics, but also incredibly scary because it shows the power that exists in the technology to operate with surgical precision. And I don't think a lot of people understand the capabilities that we have with data to sort lines of political boundaries. And I guess an open comment is, or question, I guess, is how do you deal with gerrymandering when you have this level of precision at our hands?
It's a good question, because a lot of gerrymandering has been driven by our ability to sort voters precisely. And, it's actually people that I work with that do that gerrymandering, and you can like it or not, depending on who they're gerrymandering for. And they're doing what we did is, we loaded this data into essentially what was a supercomputer and measured these distances in a way that wasn't possible 10 years ago. And that ability will just keep getting more. And so technology in some ways is the enemy when it comes to these types of things, right? And we're not going to undo technology. So the answer in many ways is rather in our legal system, is not for social scientists like myself, but for lawyers and for judges and for elected leaders that understand that how we change the laws and make gerrymandering more, or I shouldn't even say gerrymandering, how we make redistricting more of a nonpartisan process. You know, the goal that we're not probably ever going to get to this country for people that are lofty thinkers like myself is to eliminate single member districts. But you know, that's something that's so built into the fabric of the way we think about doing elections for Congress and such in this country. I don't think we're moving that direction. Yeah.
Thank you for this incredible presentation. I wanted to speak briefly to the last year and a half in the pandemic and what that has meant for a digital democracy.
Right.
Anyone who ran an election last year knows that virtual house parties, town halls, et cetera.
Right.
And how do you, in overlaying some tools that I think may stay, right, and may in some instances provide more access to democracy, how do you overlay this moment that we're in around shifting everything online with the physical space that you've been discussing in terms of schools, workplaces, community organizations, churches that actually have become digital space as well, whether that's good or bad? And what does that mean with the data that you have?
Yeah, so this is a great question. It's one I get a lot. And I'll tell you sort of a empirical reality, and then I'll tell you perhaps a policy recommendation comes out of this. So one empirical reality is we tend to think that our digital spaces are these great, places where our offline spaces don't matter, and where everybody comes together no matter where they are, and and talks to people that are different from them, and that in a lot of ways is overstated. There's a lot of research on this where in many ways our online spaces are just reflections of our offline spaces. A lot of people in this room that are good at meeting people and have traveled around the world, we know a lot of different people, and we have friends from college that are on our Facebook page or whatever and from our previous job. Most people aren't like that. Essentially the people that they know or the people that are on Facebook are the people in their neighborhood, right? And we see this, we know this very well. So these aren't the great dividers or the great uniters across offline spaces that we might think they are. But all that being said, that's just a comment to say we shouldn't overstate this. There's actually really good evidence that these online spaces can bring people together despite those limitations. I was talking to my undergrad students about this the other day. There's been experiments, for example, in other parts of the world where people have been essentially encouraged to shut off their Facebook pages for a week, and then we see what happens. And what you find, for example, this is like in Bosnia-Herzegovina, which is a country that's really torn apart by ethnic divisions. When you shut off people's Facebook pages, their ethnic conflict actually becomes worse. And part of that is, and that surprises people because we tend to think social media makes everything awful, and maybe in a certain respect it does, but it's also because we tend to meet people we wouldn't otherwise meet in online spaces. And when these Facebook pages were shut off in Bosnia, people didn't have anybody to talk to except for their friends next door that spent all their time probably talking bad about other groups of people. And so, there is something to be said for these lessons we kind of learned when we were forced into these online spaces in digital democracy for a uniting function that we have trouble recreating offline because of some of this segregation I'm showing you here. And I think, as leaders, all of you to think about how we can move those things forward while at the same time maintaining this ability to come together in real spaces is an important thing for thinking about the future of democracy.
Well, thank you, Ryan, so much. So I ran off that same question. I ran a statewide campaign in Arizona during the pandemic, and I just got done reading Talking to Strangers, What We Should Know About the People We Don't Know. Very intriguing as well, too. But wanted to know in regards to your research and data in regards to the conspiracy theories that have transpired throughout COVID. And I know that when there are pandemics or big issues, the conspiracy theories tend to just evolve more. And I know during the campaign, I experienced this with not only my own family members, but also strangers. So trying to get more information, on conspiracy theories.
Yeah, so I think what sounds like what underlies your intuition about this is often our segregation from people can make things like conspiracy theories worse. And when it comes to the ones, and this is true, when it comes to things like COVID in particular, we actually have evidence for this recently that we're getting ready to publish. And part of this, because what we did is we took data like this and we overlaid it with these big surveys we've done in the United States about things like COVID and other questions. And one thing we found, and this isn't necessarily conspiracy, but it's behavior we shouldn't condone, is what we found, for example, is the tendency for people to wear masks was not only a condition of their personal choice, but who they were surrounded by. And so, for example, Republicans, whether or not they would wear a mask, goes down sharply the more Republicans are surrounded by. And you could see how that works, right? If there's a partisan valence, as we would say, to wearing a mask, and you're walking down the street and nobody is telling you to put a mask on, or they're wearing or nobody else is wearing a mask, it becomes easier for you to accept that. In the same way that if you have a conspiracy theory and nobody pushes back on you because you're not hearing from from other opinions, then it's easier for you to internalize that and accept it. And so very much we think this plays into this phenomenon of people getting misinformation and of people dividing, even if we all have the right information, and people dividing on the opinions they have about those things. Thank you.
Come up here this time. This is no fun. This is the bye. I don't like that. I just wanted to end by saying thank you first, Ryan, for that. It was really fantastic and fascinating and thought-provoking. And just to all of you looking around, I just want to say thank you really so much for being here. I know that for many of us, this was our first time away from a group other than our families. And I just can't think of a better group, more inspiring group that I would want to spend that first time away with. So thank you so much. I started by yesterday saying I was hoping you were going to leave with a notebook full of ideas, which I hope you did. I talked about wanting to hope you're getting to make those connections, and I watched you do that over the last 48 hours, and I'm so glad, and that fills my heart. And I know that we were here together while the Build Back Better agenda was signed this morning, which is kind of amazing. We didn't even talk about that. And of course, now we go home, you go home, and the hard work of governing begins and implementing all of those things. And also, as we've been talking about this afternoon, trying to figure out how we talk about that in a way that resonates with people and makes it clear the impact that we're having on their lives. So we are going to continue to work with you to do that. We're so grateful for you being part of this community. Looking ahead, we'll gather together again in Philadelphia in the spring. I hope as soon as we have dates, we will let you know when that is. Sir Derek will be bringing us together. We're looking for your evaluations to drop those off, please, on your way out the door, so that we can continue to make our events as best and useful and as we can for you. And also, please keep telling us what you're doing so we can amplify your voices and your stories. But we love you. We're so grateful for you. We're so grateful for everything you do every day and for being with us. So travel safe home. Thank you.